Thanks, Chris, so much. We appreciate your good words and really helping us ground us and start us off for the day. So, as Chelsea said, I am Lacey Wind. I'm the Vice President of Tribal Health Programs here at NIHB. I'm joined today with uh, the real brains of the outfit. And this is kind of her dream child is Chelsea Bellon, the Tribal Health Programs Manager. And also we will hear from our Youth Advisory Council member, Jawan Ben. I also want to recognize that we have some team members. And so in the back end in helping with tech is Dree. So if everybody could just be helpful and gracious with the presenters. Instead of turning yourself off mute, keep yourselves on mute, please, everybody. Again, keep yourselves on mute and use the chat box to help with any kind of technical difficulties or anything that you need assistance with. And Dree will be watching the chat and answer questions and help you throughout the day. So if you're not familiar with NIHB, we serve all 575 federally recognized tribal nations, and we work alongside the tribes to protect sovereignty, uh, tribal public health, and support the health and well-being of our communities. We are the only nonprofit that really is developed by the tribes for the tribes. So I would like to kind of recap what amazing work happened yesterday, and just kind of honor uh, what happened yesterday so that we can kind of move forward. We had really powerful conversations about behavioral health, healing, resilience, and identity. Uh, we really talked about what was happening in our communities. We discussed the impact of microaggression and how culture can both help in prevention and healing. And then we really learned a lot from each other about programming and what is working. And then also we heard from the Indian Health Service, which was great. So as we're moving forward today, I encourage you to show up with curiosity, courage, and open heart. Behavioral health still remains an urgent priority in our communities, but we know what works. We know that connection matters, that belonging matters. We know that culture, language, tradition, and community are powerful protective factors. And we know that culture is medicine and culture is prevention. Um, so if you haven't already, if you want to use the chat box to introduce yourself, tell us where you're from, and just really try to connect through the chat. You guys can have conversations with each other, ask each other questions. Please just introduce yourselves now. And again, if you have difficulties with tech, please use your chat box and do not take yourself off mute. Again, I want to recognize two of our Tribal Advisory Youth Council as they are the ones that really developed this agenda and had been working hard. So Tara Lynn and Joanne, um, this summit is really powerful because it comes from the heart from our youth. Um, and from there, I will hand it back off to Chelsea. It's going to be a great summit, and we're all glad that you are joining us today.
Thank you, Lacey. Thank you, Chris, if you're still in the space with us. So I just wanted to briefly glance at our schedule today. And yesterday, I think we found that we're all really good at adjusting to the flow of things and times. And so there might be opportunities where, we can fill some time with conversation like we did yesterday. I want to make that happen in this space. But more than anything, I really want to remind folks to take care of themselves, hydrate, eat your meals, stretch. I don't know if anybody felt it yesterday, but when I stood up, my bones and my joints were a little achy. So make sure you take care of yourself. The point of this summit really is to highlight connection and resiliency, but to emphasize those two things, we often have to talk about really difficult topics and personal stories and reflect on our personal stories. I find myself doing that yesterday as well. So just be careful with yourself. Give yourself grace, step out if you need to. But I'm really, really, really excited that everyone is here. At this point, I'm going to stop sharing screen and I'm going to introduce our first speaker, our keynote speaker, and do a little introduction while he puts up his slides. So at this time, I would like to introduce Dr. Damien Chase-Bigay. He is the Associate Professor of Social Epidemiology and Indigenous Health at the University of Montana. His work focuses on Indigenous behavioral health, culturally grounded prevention approaches, and supporting Native youth leadership through community engaged research and wellness initiatives. Thank you so much for being here, Dr. Chase-Bigay. I personally have had the opportunity to learn from him in a classroom at the University of Montana, and the way he presents and the way he has his knowledge shared is just admirable and inspiring. And so I thank you for being here.
Thank you so much for having me here. We're going to start today with some tech stuff. So I didn't think about the fact that you guys right now are probably seeing my big presentation slide, right? Chelsea. The only thing is that puts my speaker notes over here, which I don't want. So we're going to play around a little bit. But now you're seeing my notes, right?
We are, yes.
Yeah. So how do I do that? Okay, so let's.
So click on display settings and you want to swap screens.
Yes, but I actually want to physically swap screens also. So we'll see if it's going to let me do that. Nope, I might have just made it way worse. Okay. Well, of course.
The good thing is we have time. So,
Exactly.
yeah, and everyone is probably refilling their coffee or drinking their water, hopefully, eating their breakfast. It's
Am
so
I still
nice to
sharing
see
or am I not
everyone.
sharing anymore?
You're not sharing anymore.
Oh, okay. Then what I'm perfect, I think. Then what I want to do is move this over here. And now let's try this again. Start that. And then, okay. Are you guys seeing my notes still, or are you seeing the full thing?
We are
Just the full
seeing
thing.
you.
Okay. Took a minute, but I got it. So, Tashkani Doja, good morning, everybody. Hampeshish, Minathan Pakoshosh, Ehenoja, Maminipti, Manuetanosh. So, my name is Damien Chase-Bigay. I'm Mandan and Arikara, which are two of the three affiliated tribes of the Fort Berthold Indian Reservation in North Dakota. I was born and raised here in Missoula, Montana. The reason actually that I'm from Missoula is that back in the 1960s, our tribe gave my grandma a tribal grant and a tribal scholarship, and she came over to the University of Montana. She studied nutrition and she went on to become a nurse. And that is really my exposure to health and to the Indian health system has been present, from my grandma, literally from the day I was born. And so I left Missoula for many years and returned. And so I now have the pleasure and the honor of living in my hometown in Missoula, Montana, and working in what is really my dream job. So I'm now an associate professor of Indigenous Health here in our School of Public and Community Health. And today, I'm here and we're all here focusing on behavioral health. And I have a really long professional background in the field of behavioral health, specifically within Native communities. But before I really dive in, and talk about things like research and public health and careers, I want to talk about something that I think is incredibly important, and that's relationships. Everything that I have accomplished has been possible because somebody believed in me. People invested in me, they guided me, they believed in me. And today, what I'm hoping to do is frame behavioral health as being about community, about culture, about wellness, and most importantly, about the role that each of us plays in creating a healthier future. By the end of our time together today, what I really hope is that you walk away from this seeing that your story, your culture, and your voice all absolutely matter. As we get started, I want to ask each of you to do something. Think about those people who have helped shape who you are. Maybe it was a parent or a grandparent. Maybe it was an elder. Maybe it was a teacher or a coach. Sometimes even it's our siblings and our friends. None of us become who we are alone. We are shaped by our relationships, hopefully for the better. The idea that wellness happens through connection is one of the most important lessons that I've learned throughout my life and throughout my career. So as I'm moving into my journey on the next slide, in the chat and just, in your own mind, who has helped shape who you are today? My path into education was definitely not a straight line. I know that on this slide, it looks like a straight line. It looks like it just moved, straight from left to right, but honestly, it didn't. My path started, here in Missoula with my family, with my community, with the values that I learned, growing up both here in Missoula. I was fortunate enough to be able to go back and forth between my hometown and my reservation, Fort Berthold. But in my situation, neither of my parents graduated high school. It doesn't mean that they are not smart. They're both actually, I think, brilliant people. It doesn't mean that they weren't amazing role models. They taught me so much. It just means that I never had formal education modeled for me. And because of that, my path into and through education was a little crooked and winding, and that's okay. I might not have found the shortest path to my destiny, but I found the path that is 100% distinctly me, and that's okay. I worked in the Indian health field for almost 30 years before ever becoming a professor. I mentioned that, my grandma was a nurse when I was young. She had already retired from her primary nursing career. And in her retired life, she volunteered as a nurse at the Helena Indian Alliance here in Montana. And so I grew up around Indian health. And I started my career in 1994 as a peer reproductive health outreach worker. Now, that's a lot of words. What it means basically is that it was my job to go out and convince other natives to wear condoms when they're having sex. That was really my job, was to talk to other native youth about sex, to help them, make responsible choices, to keep themselves healthy and safe. And I started my career in Indian health at that peer-to-peer level. Throughout my career, I've worked my way up through the organizational hierarchies in many different roles. I've been a coordinator, I've been a supervisor, a manager, a director. Eventually, I was the executive director of an urban Indian health center, the one here in my hometown in Missoula, Montana. I was the executive director of the National Council of Urban Indian Health in Washington, D.C. And over all of those years, the years that I spent at the Native American Health Center in California and Oakland, the years that I spent, at All Nations here in Missoula, the years that I spent at NCUI in DC, I have worked with some amazing, amazing behavioral health clinicians. I've worked with counselors, I've worked with psychologists, I've worked with psychiatrists. And what I want to share today is really just a reflection of my own experience and understanding of behavioral health from my background as a professional, but also my background as a Native person. When people think about behavioral health, especially in the mainstream community, they often think in very clinical terms. They think about things, like diagnoses and symptoms and treatments, and those things absolutely matter. They are a part of the picture, but they're only a part. Community members over the years, elders, aunties, uncles, family members have taught me that wellness is also about identity. It's about belonging. It's about purpose. It's about relationships. And it is absolutely about culture. If we only focus on what's wrong through this clinical model, if we're only looking at what are the symptoms that are being presented, how are we going to understand those symptoms separate from the person and treat those symptoms without treating the person, then we end up missing many of the things that actually help people heal. Healing is more than just clinical healthcare. Native people, Indigenous people have always understood that wellness is both connected and interconnected. Our family, our community, our culture, even our spirit, the land that we're on, all influence how we live and how we feel. And they can influence those things for the worse, or they can influence those things for the better. Long before public health systems created diagrams and models and frameworks, our communities inherently understood that people, individuals, do not exist in isolation. When one part of our community is struggling, it affects other parts of our community. And when one part of our wellness is struggling, it affects other parts of our wellness. The opposite is also true. When we heal a part of our community, we're bringing healing to our whole community. When we heal a part of ourselves, we're bringing healing to our whole selves, and understanding that we can't separate out our physical health, our emotional health, our mental health, our spiritual health, that we have to understand how we can work with all of those components of ourselves and our communities at once. Our culture is built on that understanding. And I say our culture, understanding that our cultures are beautiful and distinct. And what it means for me to be Mandan is different than what it means for someone else to be Navajo or Seneca or Chumash or whatever tribe you come from. I want to pause and talk about my culture and my story and why it is that I know and understand why culture is protective. It's a story about behavioral health, but it's also very much the story of who I am and why I do what I do. So growing up, like I mentioned, my neither of my parents graduated from high school. I grew up around alcohol. My parents, my grandparents all struggled with alcoholism. There was a lot of dysfunction and trauma in my family. When you look at my grandparents' generation, my grandma and her sisters were all sent to different boarding schools. The traumas that they experienced shaped how they were as parents, which in turn shaped how my mom was. My dad's white, my mom's Native. but I was raised with my mom. And so I grew up more with my native family and very much in an environment of alcoholism. And as a child, it experienced, some pretty severe psychological and sexual abuse. So both my brother and I were sexually abused. We were molested for several years by a gentleman, within our family. And that abuse took place from the time when I was about 8 or 9 until I was, I think, about 12. And so this would have been back in the 1980s. And in that time, in that era, there was so much stigma around behavioral health, around trauma, around abuse, that we were told not to talk about it. My brother and I, the very first thing that my mom and my stepdad told us was that we didn't tell people about it. We didn't talk about it. We didn't talk about it with other people. We didn't talk about it with our families. And what that really meant is that we didn't also talk about it with ourselves. And it created a situation in which not only was I taught to ignore what happened, I was also taught to ignore healing. And so I went through my teens and my late teens and my early 20s very angry, struggling then myself with alcohol, and was abusing alcohol by the time I was 16, 17, and starting down a path really of self-destruction. And I it was this weird dichotomy where, like I mentioned, so when I was 18, I got out of Montana. I left Missoula as soon as I turned 18. I couldn't wait to get out of here. Left Montana. I enrolled at Portland State University. I went to Portland. Again, though, I didn't really understand how higher education worked. So, and I was also, broken and not healing. And so my attempt at studying at Portland State was absolutely a failure, but it was a failure because I hadn't done the work to heal. While I was in Portland, uh, I was very much, I was drinking heavily. I was, it was this weird, like I said, dichotomy where I was working in a program where, I was given a responsibility as a health peer reproductive health outreach worker, and that was my face, my persona during the day. But literally, the minute I got home, I was moving straight into dysfunction. Eventually, that caught up with me. Eventually, I lost my job. Eventually, so this is, in my early 20s, I ended up losing my apartment. And was living out of my truck and was living I outside of Portland. There is a really beautiful mountainous area. And so I basically just took up living in my truck on the side of a lake, and I would fish, and I would, bum money from my mom, bum money from whoever I could. And, that would buy me alcohol. And so at night, I was drinking, and during the day I was fishing, and that's basically just how I subsisted. And a lot of during a lot of that time in my mind, what I was telling myself is, I'm living off the land. I'm doing like my ancestors. I'm good. But that wasn't good. That wasn't healthy. And one night when I was out with my drinking friends in Portland, I mentioned the anger, but the anger also really came with bouts of, rage and violence. And I was out with some friends and I was drinking, and one of my friends, I don't said something that, you know, pissed me off. It made me mad. And I ended up punching a car window. It wasn't my car, broke the window. Police were called. I got arrested. It was a misdemeanor. So, it wasn't necessarily a huge deal. However, my mom's sister my mom, of course, told everybody. My mom's sister found out about it, and my mom's sister reached out to my Uncle Willis. And so I say uncle, he, for our family, he was the root doctor, which is our version of a medicine man, a medicine person, that he did doctoring for, most of my family when I was a kid. And my aunt reached out to him, and my Uncle Willis reached out to me. And he called me, and this this is before cell phones. This is back in the day of actual landlines. And he called me, and not with judgment, not with anger, but with concern and with care. And he said, you need to come home. And I, for several months, avoided it, mainly because I knew that he was right. I knew that things weren't okay, but I wasn't ready to tell myself that yet. And I definitely wasn't ready to be vulnerable around other people. And so I hesitated. It took me a couple months, but finally, I was at a point in my life where I was like, honestly, there's nothing left for me on this path. It's either I'm going to move into a position of total destruction, or I'm going to go home and I'm going to give my Uncle Willis a chance to work with me. And so my Uncle Willis, what we have a term that we say, he put me up on the hill. And so that means that he took me through ceremony and went through this ceremony. And I don't have the rights to talk about that ceremony. It's not that, I can't or won't. I just don't have the rights to talk about that ceremony. There are other people in my tribe who do have the rights to talk about that ceremony. But I went through this ceremony. He put me up on the hill. And after these several days working with him, and it was, for most of that time, it was just me and him. There was some time where some of my family and cousins came up, but for most of the time, it was just me and him. And when we were walking down the hill, because the putting up on the hill, there's actually a literal hill. It's a phrase, it's a term, but there is also actually a literal hill. And so as we were walking, down the hill, back down, to the car, he said, three of us walked up that hill, but only two of us are coming down. Your anger, it's going to stay up on that hill. Not because you're ignoring it, but because you're honoring it, you're processing it. We spent this time together. You did the work. This is now where that anger is going to live. You in the future will be able to come back and honor that anger when you need to, but it's not going to be in you. It's not going to live in you, and it's not coming down the hill with us. My life completely changed from that moment on. One of the strongest messages that I hear from communities is that our culture promotes wellness. It's not separate from wellness. Wellness is encompassed within our culture, within our ceremonies, within our language, within our traditions. All of these activities, they strengthen our identity, they strengthen our belonging, but they also strengthen our wellness. Culture provides meaning, it provides connection, and it provides resilience during difficult times. I didn't live on the reservation. I didn't live full time with my Uncle Willis, but I had that connection. I had that connection through my family, through my community, so that when I needed it, it was there for me. Rather than thinking of culture as this add-on, as this extra program or activity, I think of culture as our wellness system. Humans are social beings. We are meant to be connected. Our families, our friends, our mentors. For me, like I mentioned, Uncle Willis, Over the years, I've got to have some amazing relationships with other elders and other mentors. Our community all help us navigate the challenges that we experience in our life. As a child, I didn't have control over a lot of the experiences that happened to me. As an adult, I was able to rely on the connections that I had to help me feel supported and valued and hopeful, to help me feel that when I came down that mountain, that the parts of me that had failed for so many years were not in charge of my future. One of the most powerful things that we can do for ourselves and for others is to strengthen our connections. Your connections individually, but also our connections within our community. Finding ways to link elders with youth, to link our aunties and uncles with our nieces and nephews, to link our cousins with our cousins, our siblings with our siblings. Building those connections, building those bonds provides a resource and support when we are trying to navigate challenges. The beautiful thing about it, though, is it also provides us family and friends with whom we can celebrate success. We can be vulnerable, we can get help, but once we're over on the other side, we can also be happy and be healthy together. So what does this look like? How does this happen? And one thing that really bothered me, I mentioned that, I worked my first real professional job was a peer reproductive health outreach worker. I had a couple years where, were not the best years of my life. And when I was 24, I was 21 when I mentioned when I was by that time, I was basically homeless. I didn't consider myself homeless. I had my truck and I had a tent and I was living by a lake, but so that was 21. Had a couple years of readjusting, moving back in, and by the time I was 24, I actually got hired at the Intertribal Council of California and started really, the bulk of the first 6 or 7 years of my professional career there, working in youth services. And when I was working in youth services, at that time, so this would have been probably like early 2000s, there was this buzzword that used to, all of our funding, we wrote all of our grants around this idea of youth development. And we were going to develop the youth. We were going to create the leaders of tomorrow. I disagree with that. I don't believe that. Native youth, indigenous youth are leaders. It's not something that you have to wait to come into later in life. Our youth, you all are already teaching. You're teaching me. You're organizing. You're creating. You're advocating. You're helping your communities every day. Leadership is not defined by a title. It's defined by the choices we make and the way that we show up for others. And when I talk about culture, reinforcing those values, and part of culture being language, in our language, in my tribe, in Mandan, our language, Nueta, in English, there's this word chief. In Mandan, the actual word that we use, Numakshi, literally just means good man, good person. You get to be in charge. You get to, help lead the community because you have shown that you are a good person. Your choices, the way that you treat yourself and the way that you treat the people around you have shown that you show up for yourself and you show up for others. And that is when you are entrusted with that responsibility of leadership. there is a place in this world, in this work, in this role of leadership for all of us. People, in the work that I do, working in health systems, people often think that, helping your communities, and I'll be honest, like when I was younger too, I thought that helping a community means you have to become a doctor or a counselor. Those careers absolutely are important. Like I mentioned, throughout my career, I've worked with many doctors, many counselors, psychologists, psychiatrists. These are amazing people. They're doing really great work. Those careers are important. They have a role in supporting and maintaining wellness for our communities and for our people, but they aren't the only paths. We need in our communities, we need researchers, we need teachers, we need policy leaders, folks like Chelsea and Lacey. We need peer supporters. We need public health practitioners. We need traditional healers. I would not be alive today, and I at least would not have the type of life and the quality of life that I have if it would not have been for a traditional healer. We need community advocates. Every one of us, every one of you, but every one of us has a different gift. And maybe that gift absolutely is you're going to be a doctor. You can remember anatomy, you can remember chemical names, you can remember processes and all that stuff, and that's great. There is a role for that. But there is also a role for someone who wants to be a teacher. Someone like me, I love research mainly because I get to be dumb every day. Every day, all I do is ask questions. I don't have the answers. As a researcher, I get to go out and talk to people and learn things and read books and learn things every day. Every day, I get to admit my own ignorance and I get to learn things that change my perspective. That for me is my dream job. Everybody's dream job is different, and your path is absolutely of value to your community. So I want to talk just a little bit. This is the wonkiest, the most formal slide in the whole presentation, but I do want to take some time and really talk about, what is it that I do? So I work right now, I have funding from the National Institutes of Health, specifically from one institute called NIDA, the National Institute on Drug Abuse. And when I worked for 6 years at Intertribal Council, and then in my 30s, I got a job at Native American Health Center in Oakland, and that really started my career as a healthcare administrator. And so then I worked at Native American Health Center in Oakland. I've worked at All Nations here in Missoula. I worked at NCUI in DC. As a healthcare administrator, one thing that constantly frustrated me, made me so angry, but also motivated, was that whenever we had a patient, one of our community members, a brother, sister, an auntie, or uncle come in to our clinic and they were struggling with substance use, they could see our doctor and our doctor could prescribe them Vivitrol, Suboxone, Methadone, whatever made sense clinically, medically. And then I could turn around and ask CMS for funding for that visit. I could ask Indian Health Service for funding for that visit. I could ask insurance companies for funding for that visit. And they would be like, sure, here you go. Here's your money. I could have that same patient see any one of our licensed counselors, psychologist, psychiatrist, same thing. I could turn around, ask CMS, ask IHS, ask insurance, and they would pay me money. But the minute I wanted that same person to meet with our traditional practitioners, all of those forms of payment were off the table. Even Indian Health Service would not pay for our traditional health practices. And that just made me so frustrated because firsthand, I knew the value of our traditional practitioners, both from my own experience, but also from sitting and listening to community members, to, our clients, our patients, our community members, our aunties, our uncles, talk about the value of those practices and how we have people who have gone through recovery several times in a clinical model and never achieved the same type of success that they achieved when they worked with a traditional practitioner. So my research focuses on how we incorporate our traditional practices into our substance use prevention and treatment in a clinical setting. Specifically, I work with the 5 urban Indian health centers here in Montana, and we're working together. Even though I'm native, I'm not taking charge. I'm working with the community, and we are putting together what programming can look like that it is based on, not just includes, not incorporates, because then what happens is the medical model is still going to end up just consuming it, but practices that are actually based on our traditions, our ceremonies, our traditional healing. And so that's the work that I get to do right now. But what about your work? So I want to, as we come to the end of this discussion, leave you with some questions. My job, I don't have the answers. I don't have the answer for every single one of you. I barely have the answers for me. I think I've demonstrated that. The answers that I do have, I found through failure, and that's okay. That was my path. But if you, 5 years from now, 10 years from now, 30 years from now, if you look back on your life, if your children and grandchildren look back at your life, what would you want to remember? What would you want them to remember? How would you want your future generations to describe the way you treated people, the way that you contributed to the community, and the way that you treated yourself? Every decision that we make today helps shape the future that our children and grandchildren will inherit. From my teachings, was taught the 7th generation philosophy. So thinking that every decision that we make now, we have to think about how it's going to affect our grandchildren's grandchildren. That kind of thinking, that worldview and culture can help provide you a foundation for which you start thinking about what your legacy will be, and then work toward that legacy. Work toward it in whatever way makes sense for you. Maybe it does make sense, and you're going to become a doctor, and that is awesome. Maybe for you, what makes sense is you want to become a teacher. You want to work with young kids. You want to work with high school kids. You want to work with college students. That is excellent. Maybe you have a voice that can't be constrained to an office. Maybe you need to be out there doing the advocacy, doing the really upfront, in-your-face work that I'm just not comfortable with. Me personally, I like sitting in my office. My office, I'll be honest, this is my happy space. But that's not the same for everybody, and it might not be the same for you. The future of Indigenous wellness, the future of Native wellness, is not going to be built by any one person. It needs people like me to sit at this desk, to sit in my office. It also needs people to become doctors. It needs people to become advocates. Our future will be built by our communities, by our families, by you as current leaders and future leaders, and all of us working together. You already, every single one of you, carries strengths, carries gifts, carries knowledge that your communities need. Your communities need you in order to heal, in order to stay healthy. That is your medicine, and you carry it with you everywhere you go. I hope that my time with you today has shown you that it's okay to find your way, to find your voice, but most importantly, to let you know that we need your voice. So thank you for spending this time with me today. Mashihanesh, Mashihetane.
Thank you. I'm trying to hold back some tears. So thank you so much for that.
I'm gonna stop
Oh,
sharing. But
I'm not.
now, I'm sure I missed something. I'm sure I messed something up. So now let's talk. What did I miss? What is it that you guys are out there doing that's so amazing that I need to know about? And or if you have questions for me. I can see from the participants that there's 140 people here. I would guess at least one person has something they want to say. All right,
Hi,
hands going
Damien.
up. Oh, sorry. Uh, Jade, I saw you unmute, so go ahead, Jade, and then we'll go Sonia and then Karen.
Yes, I didn't see the
That's
raise
okay.
hand function. I'm sorry.
That's okay.
I was just going to pop in and kind of ask a brief question. I'm actually here in Montana. I'm on the Fort Peck Indian Reservation as an enrolled member. I'm working with the Crisis Coalition for the reservation and the county out of Wolf Point, Montana. And I'm part of the Behavioral Health Advisory Council. And part of the work that we're kind of watching and keeping our thumb on is with Heidi DeRoche and that reimbursement for traditional practices and traditional healing models.
Yep.
So I was just curious, do you work with her at all with the Office of Public and American Indian Health or in that
Never heard
work?
of her. No, I'm kidding. Yes. So, love Heidi. So Heidi is it's called the Department of Public Health and Human Services, is the big agency. If you are on this call right now and you live in the state of Arizona, California, New Mexico, or Oregon, your state already has an approved CMS waiver that allows your Indian health systems to bill for traditional health practices. Those are the first 4 CMS approved in the whole country. If you live in one of those states, how amazing. Montana does not yet have that. However, in Montana, we have a group called the American Indian Health Leaders. So in Montana, we have 8 federally recognized tribes. There's more tribes than that. So just like the tribe that I'm from it's according to the federal government, we're the 3 affiliated tribes. Well, I mean, we're only affiliated because you stuck us on the same reservation, 100. But there's 3 totally different tribes: Mandan, Hidatsa, Rikra. The same is true in Montana. So there's 8 federally recognized tribes, but those represent more than just 8 tribes. But within those 8, each of those 8 federally recognized tribes has a health program. And then there are 5 urban Indian health programs. And so the American Indian Health Leaders includes all 8 tribal programs and all 5 urban programs. And we are right now in the process of working. We're actually going to be meeting in Billings next week, and we are working to get our ducks in a row so that we can present our thoughts to Heidi, because the state is the one who actually has to put forward that waiver proposal. We can't do it. As the Indian health programs, as the Indian health providers, the state has to do it, but we don't want the state to decide what that's going to look like. So we're going through that work right now. And so, sorry, I missed, the person disappeared. I think it was Jade was the name. If you want to trek down to Billings next week, please join us and let's have that conversation. Shoot me an email and I'll be happy to share that information with you. Sonia.
Solito, Sohishiful, Sonia Fraser, Chikasha Micha Chatasia. Hello, my name is Sonia Fraser. I am Choctaw and Chickasaw. I've been a registered nurse for almost 25 years now. And I just recently retired from Commission Corps and Indian Health Service. And everything that you have mentioned today, I have experienced that myself. I grew up on the Yankton Sioux Reservation in South Dakota, even though I'm not Choctaw and Chickasaw. I mean, even though I am Choctaw and Chickasaw, but they adopted my family into the community. And I learned early on about how powerful our identity is to our lives, our way of living. And when I came back to Oklahoma, it was a very cultural shock for me because a lot of our tribes are assimilated.
Mm-hmm.
And that's because of the forced removal and, the boarding schools. Oklahoma had the highest number of boarding schools. So we can still see the remnants of it. And so that's what I have been advocating for Indigenous nurses, because, we're the lowest number of nurses in the profession. We only make up like 0.4 of the nursing profession. So that's what we do, is we're trying to advocate for more Native nurses, and especially for our nurses to heal as well. Just like everything you said today, I connected with all of it. And I just appreciate everything that you shared. One area that I have experienced the most is racism. Racism with my colleagues, with leadership, because whenever you grew up in traditional values and you try to explain that culture is medicine, and this is what we need to incorporate in our healthcare system, and you just get met with so many barriers. And so I just want to thank you for everything that you said today, because you truly validated my experience, my journey, and actually where I'm going, because that's what we're doing too, is we want to create a traditional medicine in the state of Oklahoma. And, we have a lot of goals, a lot of projects that we're working towards. But like I said, I just appreciate everything that you said. And thank you for inspiring me to let me know that I am on the right journey, what we're supposed to be doing. And I would love to connect with you just to discuss some other ideas that you may be able to help us with on this journey. So thank you so much for sharing and everything that you're doing.
That reminds me, I'm gonna put my email address in the chat. Two quick things I want to say. Like I said, my grandma was a nurse. Thank you. I saw the work that my grandma did was so under-recognized. So thank you. And the other thing I'll say is that I talked about my NIH funded research. I got that. I had been putting in similar proposals for about a decade. I had put in, even a couple years earlier, I put in a proposal that I would say is the exact same proposal, and got responses like, this is hokey. This is not, real medicine. This is not real research. But I knew that it was. And I hated hearing those no's. I hated hearing those comments. But it took 6 times. But on the 6th time, I got the yes. So you're not always going to get the yes on the first time. That doesn't mean that what you know isn't valid and isn't true. So just keep putting it out there. Karen. It'll go Karen and then Serena and then Michael.
I um this here Johnson actually um it's in a
Oh no,
very
Karen, I'm so sorry. You might need to type your question in the chat. You're breaking up a lot.
Dr. Chase-Bigay, Karen did post a question in the Q&A.
Okay.
It says, have you worked with tribal vocational rehabilitation programs? They can pay for cultural services and practitioners. Rural Institute for Inclusive Communities has been very helpful too.
That is something that I actually don't have a ton of experience in, but it's a world that I'm just starting to step foot in. So the Rural Center, the Rural Institute for Inclusive, I'm going to forget, sorry, the right thing. We actually have now had our second Inclusive Health Summit, and at both summits, we were able to bring in a tribal or native perspective. And so at this one that we just had, when was that? I want to say, actually, I don't remember, but this last one that we had, we were able to bring in, his name's Joe Warren, and he works in South Dakota in that world. So that's a world, honestly, no, that I have not had a lot of exposure to and experience in, but it's a world that I'm really looking forward to learning much more about. And sorry, Karen, your audio wasn't, I wasn't getting the message great. So if there's anything else, please put it in the chat. Serena.
Bonjour. Just first off, want to acknowledge and say miigwech for sharing and sharing your story. I feel like we need our men to step up and step out and speak up and speak out. So that was just really good medicine for me. And just words can't convey. And I also am really inspired to hear about using our traditional medicines and ways of being. And I'm so happy to hear that it's coming to like urban settings because I work in the University of Wisconsin-Madison and supporting our college students who are away from home, who don't have access, who have a hard time, who want to attend ceremony, but they have to drive all the way, up north. That I'm just wondering, like, how can we, as urban Indians, have more access? Because the word sovereignty is just keeps resonating with me of like, do we really truly have sovereignty over our access to medicines, to healthcare, to culture? And then for people who, it's not uncommon for people who come to universities and say like I wasn't connected to my culture, and this is where they start learning. So it's just like, and that's such a tender and honorable thing to help support students. And it's just like limited because we are still working in this medical Western model that, yeah, I would love to connect. And I again, miigwech for your words and any thoughts you have now.
One quick thought. I am super excited. I get to, for the first time ever, I'm going to travel the farthest I've ever traveled. I'm going in November to what for me is basically the other side of the globe. And I'm going to be attending and doing some of my research work at the International Network for Indigenous Health, Knowledge, and Development annual meeting in Rarotonga, which is the Cook Islands. It's a very small island. It's a couple hours outside of New Zealand by plane. And I'm so excited. I've never done anything like that. I've traveled to Europe once. And I've traveled for the same meeting for NIHB. I've traveled to Hawaii, but I've never traveled this far. So it's going to be an experience. But my point is, I am doing that as part of my professional work. I am doing that as a faculty member of the University of Montana. And because of that, when I go, the University of Montana is purchasing for me extra international insurance, health insurance, basically saying the United States as a sovereign nation has its idea of what healthcare and medicine should look like. And me as a United States citizen, when I am out all the way over in Rarotonga, I deserve to have my definition of medicine and healthcare acknowledged as a United States citizen. What would it look like if every single one of our sovereign tribal nations had that same treatment, that as members and citizens really of tribal nations, that when we leave the reservation and go to Madison, go to Missoula, go to Seattle, go to Chicago, our definition of what is medicine and health followed us. That's the way it should be. That's the way that I hope one day it absolutely will be. Michael.
Good morning from Alaska. I just
wow,
really,
early morning.
Yeah, I'm really inspired by your talk, and of course, I've been involved with the behavioral health for 50 years in trying to develop this Western model and getting our people engaged in Western Alaska to really make sure it's a culturally relevant program that we've developed. And your story is almost like my story. I've grown up much like yours, and with challenges that we have. And I think we need to really put it on paper. And I'm glad you're doing the research and putting those findings in your papers. And I wouldn't mind getting them. We have 229 federally recognized tribes up here in Alaska, and we have no roads, and much of our lives still center around hunting, fishing, and gathering. And I think that's the approach that we are developing our behavioral health systems in a culturally relevant manner and changing from the Western model. Of course, we have to integrate the Western model and with those DSMs and everything else that we worked on over the years. So I kind of wrote my little story, Racing Towards Recovery, and looking at our issues through my lens and my observations like yours. And I know that we have the highest rates of suicide, we have highest rates of domestic violence and sexual abuse and etc. In Alaska. But I think we're in a verge of the turning point like yours. And I think every tribe in this nation has that opportunity to develop their programs in a culturally relevant manner that will work finally, and to make sure that road to recovery happens to all of us. And of course, I still have my languages. We still have our languages and our cultures and our ways of life that we haven't, we haven't let go yet. We've been, trying. They've been trying hard to assimilate us, but we're still here, and we're still strong. And but we have to really make sure that our indigenous knowledges and our approaches are respected by the institutions throughout. And I'm really glad you're traveling away and present your research papers and from your lens and your experiences. And I just really appreciate the opportunity. And thank you, National Indian Health Board, for putting this on. And I'm glad to have listened since yesterday. And I'm continuously trying to improve the quality of care up here in Alaska. Thank you very much.
No, thank you, Michael, for writing down your story. I think I got it right. So I just put it in the link because when you were saying that, I was like, if you wrote it down, I want to read it. So Racing Toward Recovery, The Extraordinary Story of Alaska Musher Mike Williams Sr.
Yeah.
I put the link in the chat. I hope other folks will read it. That's my thing. I like to read. I like to learn. So I'm definitely going to read it. So thank you for sharing.
Yeah, I've been mushing for thousands and thousands of miles out in the wilderness in Alaska, and 85,000 miles is a long ways. And so I just really put a lot of thought in my work and my education in those long miles of thinking, and it's good to be out there in thinking about all of those experiences that we had out in the wilderness. And that's where I get my inspiration to continue the life. And again, thank you for your story. I'm inspired, and we need more PhDs like you, and keep up the good work.
Well, I said in my presentation, I said over the years, I got to work with so many amazing people, including a lot of amazing PhDs. And I feel really bad because I've just taken 15 minutes away from one of those amazing PhDs. Dr. Kimberly Fowler is here. I really want to make sure that, we get to give her the time and attention she deserves, because the work that her and that NCUI and that the TARC, the Technical Assistance and Research Center, did, honestly, really helped also set my path. I didn't even know what research really was until I started working with Kimberly and Jamie. So I'm going to step back. I'm going to stay on, but I'm going to let Chelsea move us to Dr. Fowler, because, wow, I didn't realize until I saw the agenda today that Dr. Fowler was going after me.
I really appreciate, I was fortunate to be recognized with the honorary Doctorate of Laws degree from University of Alaska. So all the work that we do are recognized, and I'm sure I'm going to find out on your research papers. Thank you very much.
Thank you.
Thanks, Michael. Well, I feel like Dr. Chase-Bigay just gave my introduction. So as we transition over, I just want to express gratitude for your presentation, for your keynote. I know that there's maybe a couple more questions in the chat. So if you're able to hang out and maybe answer them in the chat, I encourage that. But thank you so much for being here today. I am going to introduce our next two speakers, and then I believe I will be sharing the screen, so just give me a moment of grace as I transition. But we are honored to welcome Dr. Kimberly Fowler, who is the Senior Vice President of the Technical Assistance and Research Center at the National Council of Urban Indian Health. Dr. Fowler has spent more than a decade advancing urban Indian health, tribal workforce development, and Indigenous youth leadership initiatives across the country. And joining her alongside is Liz Best, who's the manager of technical assistance at the National Council of Urban Indian Health, with expertise in health communications, curriculum development, and culturally relevant health education. She supports urban Indian organizations through training and technical assistance initiatives nationwide. So, hello, speakers. I'm just going to transition. And I just want to make sure, Liz, would you still like me to do the slideshow?
If you can, that would be great.
Yes. Yep. No
Thank
problem.
you.
I just want to make sure. Okay. Okay, do you see my screen?
Yes.
Yes.
Okay, wonderful. I am going to go on mute, and if you just tell me next, I will move them forward.
Perfect. I'm actually going to get us started before Liz also jumps in and helps me with this presentation. I want to also thank Dr. Chase-Bigay for all of his sentiments around NCUI and the work that we have done, and definitely appreciated his time at NCUI as well in leading us forward. But it's a great opportunity. I thank the National Indian Health Board for being here today and being able to share on the work that the National Council of Urban Indian Health is doing and has accomplished through our NCUI Youth Advisory Council, as well as some of the work that we've done around behavioral health and really just making sure that there are strategies, toolkits, resources available across Indian country and specifically for urban Indian areas to make sure that they have to continue their work in providing mental health support to youth across the nation. So next slide, please. And this is the name of our topic. My apologies. So elevating Native youth voices. So again, my name is Kimberly Fowler. As was mentioned, I'm the Senior Vice President at the National Council of Urban Indian Health for our Technical Assistance and Research Center. I've been at NIHB for 14 years, so it's been some time there, and really trying to advance the work of urban Indian organizations that provide healthcare, as well as social support and community support to American Indians and Alaska Natives living in urban areas. And so the work that we do at NIHB is important in making sure that that representation is available to support not only at the ground level, but also at the national level and at the federal and congressional level too, as well, for the policy work that we do. And I'm going to turn it over to Liz to also share about herself.
Great. Thanks, Dr. Fowler. And thank you, NIHB, for allowing us to share a little bit about NIHB and our Youth Council today. As Dr. Fowler said, I serve as the Manager of Technical Assistance here at NIHB, so I'm responsible for a lot of the training that goes on here. And much of my professional background is rooted in public health, specifically behavioral health and behavioral health programming. However, some of the work that I don't talk about, some of my most meaningful work in life has happened outside of my formal roles. I've spent many years working with young people in different spaces within my own communities, including working as an adjunct instructor, a mentor, sports coach, and also community volunteer. But during my time at NIHB, I've had the privilege of working closely with our Youth Council and really seeing firsthand what can happen when youth are given the space to lead, create, and support one another. Like Damien said, one thing that I strongly believe is that youth do not need to wait their turn to make an impact. Young people already hold the wisdom, the creativity, and the lived experience that can strengthen communities right now. And that belief is a big part of why this work is so important to me and why I'm excited to share some of the incredible work of NIHB's Youth Council. With that, I'll pass it back to Dr. Fowler.
Thank you. Next slide, please. So we just wanted to do a temperature check. I know that you may have been sitting in front of your computers for some time, and we're also heading into the summer months, whether that means getting ready for summer break or for any youth summer events that might be being planned at the moment. But just wanted to see, how are you arriving today? If you could just drop in the chat an emoji to share your feelings and where you're at right now, we appreciate that. And I think it'll be helpful for just everyone in the room to kind of hear that and know and understand that too as well. So if I had the opportunity, I probably drop in the chat that I'm definitely on fire, motivated, and passionate. Really happy about this opportunity, and also getting ready for the planning of our new year at our organization. So a lot of great passion around the planning and making sure that we have what is needed for our urban Indian organizations. So thank you. And you can continue dropping those chats. I'll move to the next slide. Next slide, please. Thank you. So for today, we wanted to cover a few objectives. One, we wanted to explore or have you take away from this session, I should say, exploring why Native youth leadership matters, learning how youth advisory groups build connection and belonging by looking at the work that we've done with our own youth council and its development, reflecting on ways to uplift youth voice in community and spaces, and leaving with one action to support your youth leadership. I'm hoping that through this presentation, you'll walk away with some strategies, some resources, and also be motivated in trying to create new space and new activities for the youth in your communities or at your programs. Next slide, please. So who are we as NCUI, the National Council of Urban Indian Health? And I'll read through this very quickly, but we represent the urban Indian organizations across the nation. There are 41, but we are a national representative advocating for them and contracting with the Indian Health Service under the Indian Healthcare Improvement Act. And NCUI strives to improve the health of the over 70% of the American Indian and Alaska Native population that lives in urban areas supported by quality healthcare centers. So that is the work that we do in ensuring that there is sustainability in the presence of urban Indian organizations across the nation themselves. Next slide, please. So at NCUI, there are 4 core areas that we support. Today, we'll be talking about the Developing Future Generations of Native Leaders core. So I'll share more about that as we go along this presentation. But we also, as actually Damien talked about, do help and support in research and development, in building the information that is available around urban American Indians and Alaska Natives as a population, just to have the knowledge and awareness with the limited research that is available. We do strive to build that up. We have a knowledge resource center that does that too as well. We also provide technical assistance and capacity building for providers at UIO. So you may have heard or been present at some of our trainings or webinars that we provide, and ensuring that we're sharing out information and sharing stories from UIOs themselves about the successful work that they have accomplished. We foundationally work within policy and advocacy, really trying to educate and make sure that congressional members, federal agencies understands the importance of providing support to anyone living in an urban area that is Native, but also ensuring that they have that there is representation at the table for when there are different matters that need to be discussed or areas for confers that happen for urban Indian organizations. And then lastly, we have our central resource distribution and funding. We really do try to make sure that along with that sustainability for education, we also try to make sure that there is funding available in order for the UIOs to continue their work. And that is done through distribution and funding, but also through our Knowledge Resource Center that I shared earlier. So next slide, please. Okay, I'm sorry, I muted myself. So the way this is accomplished is through the Indian Health System, and this is made up of a 3 area or 3-tier system that you could think about, in the sense that urban Indian organizations are nonprofits. There are also tribal supports that provide their own healthcare to their community. And of course, the Indian Health Service also provides direct service care as well. And so UIOs are an important and necessary part of this Indian health system to ensure that there is full support of healthcare across the nation, no matter where anyone lives that is American Indian and Alaska Native. Next slide, please. This is just a visual of some of the services that UIOs provide. You can see here that primary care, behavioral health, those types of services for healthcare are embedded in the work that UIOs provide, whether that means that they are, I'm sorry, my slide got small. In the fact that whether they provide general medical services or are able to provide more specialty care, like oncology, or even group services, group therapy around behavioral health. But the important piece of the work that UIOs do is to ensure that they stay true to making sure that there are culturally responsive practices provided through their organizations. And they also do this through providing different traditional practices, such as traditional medicines. And some of those are listed here. All UIOs do and are founded through Native-led boards of directors. And so that ensures that there's always a lens in making sure that foundationally they are meeting the community's needs. And then lastly, social supports, whether that is ensuring that the social determinants of health are met by their community members through food pantries, through gardens, through job placement, through WIC, through all of those types of services, including elder care. Next slide. And I think that was my last slide as an overview of NCUI. And so we're kind of move into more of the work that NCUI has been accomplishing. I wanted to share with you today about some of the work that we've done around behavioral health financing. We begin this work in the true understanding that there is an unmet need in how sustainability around behavioral health is connected to meeting the needs of anyone that walks through the door. And so we were able to work with several partners coming from tribes, coming from urban Indian organizations, even coming from the behavioral health field, and really trying to sit and listen to what they feel are the challenges around sustainability, and also hear some of their successes around strategies that they had been utilizing in order to make sure that behavioral health departments and behavioral health services are continued. And so out of that, we created this 5-strategy toolkit in which the QR code is there. And I think Liz is also going to place it in the chat. But investing in wellness, financing strategies for behavioral health in Indian country has really been beneficial to a lot of our UIOs as well as other partners. We've created some guides to help with kind of streamlining that toolkit because it is a fairly large read, but these strategy guides really do make sure that each strategy is well guided in the way that the strategies are implemented. We've done a lot of great work around some case studies too as well, in working with UIOs that are implementing these strategies and had great results. One of the true areas that even Damien talked about is around traditional healing and a need in the way in which that can be financed or covered and reimbursed. And so because of that, we have been able to work with 3 UIOs in helping them to understand how they can work with their state's 1115 waivers in introducing the need for reimbursement of traditional medicine and traditional practices. It's been very interesting because there are 4 or 5 states have implemented those waivers. And so just being able to make sure that urban Indian organizations are listed as a benefit of those waivers is the work that we have done in building their capacity to create memos for their congressional members or for federal agencies, for CMS, but also work through how the implementation path of reimbursement could occur to as well. So I encourage you to take a look at those resources. They're there for you. They're also on our social media and you can find those there. So that's one of the areas that we've worked on most recently, and we'll continue to share that out in different ways. Next slide, please. But I know today's conversation really is more so about youth and really trying to make sure that it's understood that their voice matters. It's understood that they are our future leaders for the next generation. And so when we think about youth, we try to make sure that they are heard and that they have a space in order to share their thoughts, their feelings, even their struggles and challenges to make sure that we are addressing those appropriately. And that's really how our Youth Advisory Council was grown, we saw that need. We heard from the youth councils at the urban Indian organizations and wanted to create a national space in which those youth could come together, learn from each other in a peer-led fashion, but also be able to grow and build their leadership skills. Next slide, please. Yes, and I've mentioned this a little bit already, but youth are not just future leaders, there are leaders right now. And so with that understanding, this slide really resonates with me. It's a picture of one of our youth councils at our national annual conference. The youth council was able to come and share on the work that they did over the course of their 12-month time that they were on the council. But it was such a great experience for the participants, the adults that were in the room, to hear their voice and to hear what they've accomplished. There were people that came up to them afterwards, just really being thankful from learning from them and their needs so they could take that back to their own local communities. But I love this picture. It was just a great opportunity for them as well to share at the national space and share some of their work. Next slide, please. And so our National Youth Advisory Council was established to make sure that Native communities, or I should say youth in Native communities, were supported through health and wellness, to make sure that they were able to also continue to grow through their cultural connection, leadership, and community support. It is for youth that are 25 years, the whole initiative is for youth for 24 years and younger, but the youth council itself was set for only youth council members 18 to 24 years. They were able to address mental health, cultural connection, suicide prevention, and wellness based on what they thought were important for their time on the council. Next slide, please. And so this youth council, as I mentioned, it was peer-led. They created their own rules, their own bylaws, their own ways of functioning. And NCUI was present as more of a mentorship to make sure that they had that experience of the work that we do at NCUI and understanding it. They were able to select topics that were important to them and use their time as a storytelling platform. And Liz will share more about that and how some of them were able to accomplish it. But I think it was a great way, especially during the pandemic, just to create a safe space for youth voices, to make sure that there was a connection, and also just ensure that they were heard in that time of a lot of loneliness, a lot of, being not able to be with their own friends and in their own community, but being able to build relationships with other youth across the nation. So with that, I am going to turn it over to Liz to share about some of those activities directly and the work that was accomplished. Thank you.
Great. Thank you, Dr. Fowler. And next slide, please. Dr. Fowler shared more about the why, and I'm going to share a little bit about the how. So this picture right here, you can see that this cohort of our youth council, they're all wearing red, and this was in honor of National AIDS Day, World AIDS Day. And so within our curriculum, we did try to build in knowledge of other campaigns that had to do with wellness. And this was self-selected by our youth council. And this was just a great picture. You can see, even though we're all on Zoom, they're super duper happy. So our youth council, as we were building the curriculum, we really had three different pillars. One was the mentorship pillar, which we'll talk about. And then the other one was leadership. Building leadership, but also, as Dr. Fowler said, seeing our youth as leaders. And third, they worked on a project together. And this was a behavioral health campaign. And I'll share a little bit about the different campaigns because each cohort of the Youth Council came up with something so uniquely different and special to who they were and what they thought was important. So we did start with that temperature check this as we began our presentation, and that's how we began and ended each meeting. Typically, we met formally once a month, but the youth were encouraged to meet on their own, especially as they began to work on their project. As Dr. Fowler said, they came up with their own norms and bylaws. So that was, for some, a learning experience about what bylaws are, but we wanted them to have ownership in this youth council, right? And so coming up with the norms, especially, when we're on Zoom, right? So where's your phone, right? Does this time work for you? How much notice do you have to give if you're not going to be able to attend? And so because our youth council only consisted of 5 youth members, it really was important that everybody was there. We, as I said, our conversations, right, did focus on wellness. And so those were youth-led. We did behavioral health campaign work. There was a lot of peer support amongst these 5 youth. Our application process, we really wanted to have a diverse group of youth council members, right? So all had different tribal affiliations. They were from different universities, different ages. Some were just beginning college at 18, especially in this youth council. We had 2 freshmen, and this was their first experience living alone. So they shared what it was like being the only Native youth at their university, the stigma, that they felt. And then we had individuals that were on their way to getting their PhD, some young women that were getting their PhD. And so they were really able to provide mentorship and support to some of the younger college students, which was really amazing to see. Leadership opportunities were given in our youth council each week or each month, for our meeting. The council appointed 1 member to lead that meeting. And so they were responsible for building the agenda. And we just provided the support, right? If they got, a little bit nervous about like what should be on the agenda, we worked with them to come up with what could be on an agenda. We had time for creative and cultural activities, which I'll show you in a minute. There were group reflections throughout. There were pauses. And as Dr. Fowler said through that previous picture, there was a presentation at our national conference, which really, I think, was not just a highlight for them. It was a highlight for NCUI staff, but also the attendees as well. We also were able to, we have 2 people that were on staff that were trained mental health first aid trainers. And so we were able to provide mental health first aid certification to our youth as well. So we were really proud that we were able to do that. Next slide, please. So creating a youth-centered space, we were really purposeful in what makes a space youth-centered. And year after year, as we created Youth Council, each year was a completely new cohort. So we always had to come up with what we thought would create a youth-centered space. And this was based on feedback from our Youth Council. As one Youth Council exited, we would do exit interviews and really see how we could improve as, as mentors and as, really the curriculum developers or assisters in this space. So in terms of the curriculum design, we really followed some adult learning principles, and we gave youth the ownership of this space. And so what did it look like? We wanted to make sure that our youth voices are heard and valued, and we're not just, sharing that as a bullet point. But what does that mean? And we talked about that as a group too, right? Our youth council members, they didn't always agree on, different topics. And so we talked about what creates that space that is, safe and also judgment-free. Every meeting, there were opportunities for leadership. Again, a lot of the time we sat as, kind of a fly on the wall, and, the adults in the room, or the NCUI staff, didn't jump in. We didn't always give our perspective if we had one. We had respect for what everyone brought to the table. We had time where we talked about, where do we want to grow? What are we strong at? And so as a group, we were able to begin to recognize that within one another. Wellness was always prioritized. We recognized that these are college students. They're tired. They may not have eaten dinner. They're bringing a lot of different emotions, to the meetings. And so sometimes the NCUI staff, not sometimes, but typically every meeting, we would leave and we would give them a breakout room where they would go to for, 20, 30 minutes, and just, build relationships and share a little bit about their day, without, the staff in the room. So we found that to be really important, and something that they talked about in their exit interviews, that was an important part of the time together, that it really wasn't all about work, but it was about relationship building as well. And then as the NCUI staff, we listened, we supported, we shared space. If somebody wasn't, didn't come to the meeting, or if they seemed, particularly quiet, we would check in with them via, a quick text like, hey, I saw you were particularly quiet today. Is everything okay? And just those texts went a long way as well. So as I shared, we always did like reflections with our youth in our council meetings. So I'm going to add a reflection here. So as adults that work with youth or may potentially work with youth down the line, what's one thing that you think that you can do better when working with the youth in your own communities? And if you're comfortable, feel free to drop in the chat. Next slide, please. Okay, so virtual spaces, right? We're in one right now. I think they really took off during the pandemic when we did need that personal, that virtual space for connection. But they can be tricky, right? We can get pulled in a lot of different directions. And as I shared, we created norms. We used breakout rooms. We used polls. We played games. We did a lot of different things. So as I shared, we began our meetings with check-ins and being present during this shared time, and what does that presence mean? The youth created those norms. We had space for the youth-only conversations, and we kept meetings interactive through chat, through polls, through games, and other activities. Icebreakers, we had the youth coming up with them, and they were fun and they were creative. But above all, it was always a safe, respectful, and judgment-free virtual space. Next slide, please. This is a slide, and I loved this slide, and I loved this meeting. We worked with a culture keeper, this wonderful woman who did a lot of work with youth. And she came in, and we had sent all of our youth council members an activity packet in the mail. And this one came with different beads. And just this meeting, I think this was maybe our first or second meeting. The youth council members, they did a beading activity, but it really was a time to get them talking. We definitely had a few youth council members that were more on the, I would say shy or quiet side. And by keeping their, hands busy and doing a shared activity, you could see it all of a sudden they came out of their shells. They all started talking. And because they were, some of them were, quite connected to culture. Others might not have been, but this gave them a time to speak about, different creative activities within their own cultures that were important to them, that went beyond the beating. So this was always one of my favorite meetings when we got to do something creative like this. Next slide, please. Another activity that I thought of too, and I didn't have a picture of it. We had our culture keeper come back at the end, and she has a lot of experience too in counseling and behavioral health. And she had them do an exercise where they all drew trees and who are the roots and who are the branches. And that was a very valuable activity. It ended up with a lot of emotion, coming from the youth council members. I think just thinking of how, they're connected to their past and their future. And that was another great activity. So we built those activities in, which was important as well. But one that, that everybody saw, right? And they didn't see all the work and the great learning and connection that came from behind those scenes in the meetings. The youth created a behavioral health campaign. And this was defined by the youth. So it was created to raise awareness around mental health in youth, reduce stigma around mental health issues. They share their stories and experience, create peer support systems, so touching upon topics that were sensitive to their own. And in some cases, we use different social media practices. And if you'd like to share, we'll add another reflection of what cultural practices or tradition helps you feel grounded and connected. And this reflection was a big theme that carried through their work on their behavioral health projects. Next slide, please. Great. So these are just some faces that go with our wonderful youth council. We were able to have 5 cohorts, and we hope to have a 6th sometime soon. But you can see they're different faces, different ages. They're all up on our webpage, and these are our cohorts. It was a very selective process. I think from the administrative point of view, the application process was probably some of the trickiest, right? I think, our program ran from October through September, right? And so finding youth in the summer to get them to do their applications was always a little bit tricky. And we were thankful to a lot of our partners that helped with outreach. But once we got our outreach, we had just tremendous applications. We brought in our Alumni Youth Council, which I'll talk about in a minute, and they helped in the selection process. So it just wasn't NCUI staff that was selecting, and we brought in other folks working in Indian country that work with Native youth. So we tried to keep it, a very diverse group of folks that were selecting. And it was really hard because there were so many great youth to choose from. Next slide, please. And this is some of what our youth created together. It was so inspiring to see the different mediums. So there was an Indige Wellness campaign, which was a social media toolkit, and that really spoke to those youth. We had youth do a 3-series podcast speaking about wellness, and I think that was really fun medium for them to be a part of. And we sent them, I think, microphones. I don't think they all had microphones, so we set them up for success in that way. We held webinars, and there are some one-pagers that were distributed as well and created by our youth. And then our last cohort, and you can see they all came up with a name for themselves. This one that I'm pointing to, I don't know, well, I'm pointing on my screen, but Building a Keepers of Resilience Mindset. So they were called CORE. That was our last youth council cohort that we had. And they wanted to do a TikTok campaign. And so we partnered with We Are Native. So if anybody is here from We Are Native, thank you. NCUI does not have a TikTok platform, nor there was enough time to create one. And so We Are Native launched their TikToks, and they created the scripts, but it was, a great learning experience. I think one thing that you'll find with youth is they dream really big, which is wonderful, right? But they were saying, we're going to do 3 TikToks a day, and it's going to last for 7 weeks. And we had to review the TikToks on the NCUI end over here. And so we just didn't have the capacity to be looking and helping them edit out 3 TikToks. But dreaming big is always good. And then, getting to them to really think about, the capacity of the work. And Dr. Fowler put into the chat a little more about our youth council. So you can find these great campaigns in there. Next slide, please. Great. Just a little bit about our alumni. Currently, we have 25 alumni members, and they still, we're still connected with them. We see them at different conferences. One of our youth council members here, this is her. She's defending her dissertation for her doctorate, and so I know NCUI staff attended and cheered her on virtually. We did a podcast with some of our youth council members on youth leadership programming that they're doing in their UIOs. We have Adon here that now works at one of the UIOs in the field of behavioral space. And here he is at our conference, and he was a presenter. So it's really inspiring to see what they do when they leave our youth council. And we can always call on them, when, we'd like for them to help us come up with ideas on some, trainings that have to deal more with youth. So getting the voice from them, we never forget that. So the alumni they always welcome the new cohort. They have presented nationally, not just at our conference, but other conferences. They've inspired youth virtually via virtual GONAs and other events. And so they're still really involved in our community or in their communities. Next slide, please. And so just to kind of, bring everything around full circle, we talked about the why in the beginning, but now that you've seen a little bit of the work of our youth council, why they belong at the table. One is because their perspectives help create solutions that are relative, they're inclusive. They understand best the current challenges, I think, especially, with, all of the new technology that's coming, right? They're just in a different space than many of us were growing up. Their decisions and their voices impact youth directly, right? So the behavioral health campaign, hearing from people that have been in their space is important than hearing it from public health practitioners or their clinician or their teacher. And then leadership starts, with participation. Next slide, please. And so some ways that youth can find their seat. One, they can join youth councils or leadership groups. But as Damien said, right, it doesn't need to be this formal. It can be speaking up in community spaces. It can be sharing your story, volunteering within your community or mentoring others. So it doesn't need to be something so formal. It can be a conversation with a peer about community wellness and being in a like space before. I think those are ways that you can, be a leader. But I think sometimes we think of leader, it comes with a title or more formal training. But everybody can be a leader. It can start with one conversation, one idea, one act of support or kindness within your community. Also find adults who will support and uplift your space. I think sometimes youth are afraid to have that conversation. So as adults, right, I think it's our responsibility to see how we can support youth in our community spaces. Be that mentor without the youth asking, first. And it can be just an informal conversation. It doesn't need to be something, on the calendar or formal, but look for those opportunities within your communities as well. And next slide, please. Some key lessons, I think we've touched upon all of these. The youth voice, it matters now. These are not future leaders. Connection, it will create belonging within our communities. Culture, as we saw with the work of our youth council, supports healing and connection. Safe spaces for youth to turn to, that supports growth. Leadership looks different for everyone, and small actions create change. Next slide. And with that, we'll do our closing temperature check just to close the circle as we would do in a youth council meeting. So we'll do, instead of an emoji, one word that describes how you were leaving. I think there's a break after this before you go to lunch. And And last slide, please. Our next slide, please. Yep, here is a QR code to our youth council. And if anybody has questions that we can answer now, great. But if you're thinking about working with youth and you'd like any technical assistance, we do have great resources. We have templates for curriculum. We have other areas to get you started as well. So on NCUI's page, you can always reach out. There is a technical assistance form you can fill out. And thank you for being a great audience and participating today. And with that, we'll take any questions.
While people post questions or ask questions, I just want to send my appreciation to you both. It was great to learn about some of the stuff you're doing, and it was really great to see one of your youth who also is one of our youth that helped plan and think of who could be speakers. And so it's really wonderful to see our youth in multiple spaces and gaining those leadership skills and leading the way. So thank you for all that you do. Patsy asked if we could provide resources for working with youth.
Patsy, I'm going to send my, I'm going to drop my email in here, and you can reach out to me, and then I will see what type of resources I can share with you.
Looks like there's a lot of inspired and informed people in this space. So that's wonderful. Just going to stay on just for another minute or so. And then we will be breaking for lunch, everybody, which is an hour. And you're able to come back on the same link. I'm sorry. I need a lunch break, obviously. Come back on the same link that you had when you joined this morning. And I will be stepping away for a little bit, but we also have staff that can support questions. Looks like Rachel mentioned that they are in the interview process for their first youth council. Oh, there is a question in the chat.
Yeah, so that is something that you noticed, and we noticed it too. And most of our applicants were mostly women. And so I think some of the things that we looked at were having diverse. So if we did have a strong male candidate, we were hopeful that they could be on our youth council. But sometimes, they did apply, and then there were a lot of conflicts in terms of schedule. So they did need to be available monthly for the meeting. There were orientation dates. And so sometimes just by elimination of that alone. But I think you bring up a really important point, right? Is that sometimes we see that women, especially in the college age, are looking for more of these opportunities. So I think this is part of a larger discussion, right? Of how do we engage men in this, right? And maybe men are, there's more of like a stigma to like joining this, or maybe it's all going to be women. But I loved when we had men in our youth council because they're, especially with mental health, their opinions and their knowledge is just so valuable. And I agree, Serena, I think we're seeing this in higher education. So I think the question might be, how do we engage boys when they're younger to be part of community and seeking out these opportunities? Because maybe by the time they get to college, it's a little bit too late to find them, right? And to get them to join. And it might be other men within the community being those mentors and sharing, that there are these opportunities. But that's a really great point.
We also try to encourage the youth alumni to share information with, friends, family in their community too as well. And interestingly, for our initial cohorts, we actually had a young man from NCUI who was actually leading the Youth Advisory Council, and it actually worked well. Granted, it was a diverse NCUI staff that was helping, but I do feel like having that voice in the room is definitely needed. And so we definitely always try to see how we could encourage and include someone from all backgrounds.
Thank you.
I want to say our first cohort had 2 young men in it, and that was really nice. Yeah.
Wonderful. Well, thank you both so much. I think at this time, unless any questions pop up in the chat, I'm going to also check the Q&A really quick. We will break for lunch. And I hope that everyone's been here today can come back after lunch. We've got a couple of great speakers to close out our event and kind of celebrate the last 2 days that we've spent together. So thank you. I will go on mute and you can go ahead and reach me in the chat. Thank you so much to our presenters this morning. I appreciate all of you. Good afternoon, everyone. We're just going to let folks in, give it a minute or two, do some final stretches, make sure you have water. Hope you enjoyed your lunch or breakfast, maybe. We'll just give it another minute while folks rejoin the space. Wonderful. Okay, as you enter the space, let's see, why don't we share something that you're looking forward to this weekend, since we're almost there. How about that? Okay, just making sure. There's Devin. Hello, Devin. Good to see you.
Yeah. Hello. Sorry, I joined a couple minutes late. My phone or my computer must have died. And
No,
so it took a second to load up.
that's fine. We're all coming back from an hour-long break, so
Okay.
no problem. Looks like folks are excited for the garden and the river day. Deep cleaning. Oh, you're speaking to my soul. As a mom of 3, I love a good deep clean. I was just in the garden last night. We have big plans for this evening and this weekend to clean it out and, make it look a little prettier. So good to see that. Awesome. Looks like you've got some family in the room, Devin.
Yep, I just saw that.
Everyone's family.
Yeah, do that.
Awesome. Well, let's see. We're a few minutes over, so that's great. We've got folks joining again. What I'm going to do is I'm going to ask one of our Tribal Youth Advisory Council members, Joanne, to introduce Devin, and we'll let Devin just take it away and get us started after lunch. Appreciate you being here. Joanne, go ahead.
All right, thank you, Chelsea. So our next speaker is Devin Headdress, a Dakota Ojibwe Mandan public health student and advocate at the University of North Dakota. Through culturally grounded fitness, nutrition, and wellness work, Devin is committed to advancing Indigenous health and supporting Native youth empowerment.
Oh yeah, I love the intro. Let's see if I can get my presentation here pulled up. Yeah, kind of bear with me a second here. I just noticed that my computer died like over lunch, and so it's like at like 3% trying to load.
No, you're fine. Take your time.
Okay. Yeah, see that?
It's a little delayed. There we go. Yep.
Okay. Gotcha. All right. So the name of my presentation is Becoming the Person That I Needed Growing Up. So hello, everybody. My name is Devin Headdress. I'm an enrolled member of MHA Nation in North Dakota. And Chelsea actually approached me about speaking at this NIHB Behavioral Youth Summit. And I'm someone that's definitely just like, all right, I'm just going to dive into the opportunity. I don't know what it holds or whatever. I'm just going to see it, make it work. All right. So right there, my first little photo on the right. A couple of years ago, I was the head of at UND, I was the head of their Indigenous Association there. And so I had pictures or whatever, and my buddy was just making fun of me and made like this chairman poster. So I decided to kind of put it in there as the first slide. But so opening identity. So Native identity shaped both my pain and my healing. And so growing up as like a Native kid, I grew up in not your typical two-person or two-parent household. My father really struggled with alcoholism. My mom really struggled with substance abuse. And so it wasn't until I ended up moving in high school to kind of really discover who I was. I moved in with my late grandmother, Juanita Helfrey, and I'll kind of elaborate more on her later. But she was a big part of like understanding where my pain originated from and also what healing can look like, whether it was through rigorous therapy, whatever it may be. And so I'm still learning who I am and how to carry that well. And so I feel when we're people that come from these backgrounds of trauma, no matter whether it's PTSD or things that just happen to us in life, right? I feel we have to learn to carry that and to, I don't truly believe that there's such a thing as complete healing. It's sort of something you learn to manage as you go on and, learning to regulate through those things. And so I like to tell everybody I'm still healing. So this is a story of me becoming. And that's something that really got me through growing up. Like I said, I have a ACE score, for those of you that don't know, adverse childhood experience score of 9. And so growing up, I've kind of seen little bits of everything, as many kids on the reservation do, right? Growing up in a Native household, you have to grow up fast and you see things that normally kids your age wouldn't see. And so that's why this stuff like this and presentations like this matter to me so much, personally and professionally. Personally, it allows me to really speak to people and to, really take my power back in terms of speaking about my story and what happened to me growing up and allowing me to be like, hey, this is what happened to me and taking ownership and allowing it to be sort of like a healing process, as well as professionally, speaking to people like you guys who work in this area, work with Native youth, work with Native kids who struggle with similar things that I did, because as we all know, and history has shown us that, the reservation experience doesn't just affect one demographic, it affects everybody who lives on the reservation. And so many Native youth are still in like what I'm doing and what I had the privilege of doing is the same process of becoming. All right, so this last year, a lot has really happened in the past year, and that's my late grandmother right there on the right. So she was actually a very pivotal person in my life. She was the North Dakota Executive or North Dakota Indian Affairs Executive Commission director for roughly from the 70s to the 90s. And right after that, she was a minister and a pastor. So she decided to take her work to Cleveland, where she was actually there on the front lines with AIM fighting against the Cleveland Indians logo. She was nominated, Lyndon B. Johnson, President Lyndon B. Johnson nominated her as Woman of the Year in North Dakota when he was in office. In 2006 or 2007, the Obamas wrote her a letter inviting her to the inauguration. No, it's 2008, inviting her to his inauguration, which was crazy. But that's just someone who really, that was my upbringing. That's who raised me. And so this last year, brought trauma, pressure, and rapid change. So in this past year, my wife and I moved to Montana, and then she was pregnant at the time. So we moved from Grand Forks, North Dakota to Billings, Montana. We live just outside of Billings. We got married a month later, and then 2 months later, we had our first child. And my wife started medical school all in that same period of time. And so it was definitely chaotic and kind of just one of those things where it really flares up that trauma, right? Because life's moving so fast that you don't get to really sit still and be present with what's going on. You kind of constantly just brain's just rushing, right? And so family history and memory felt close and not distant. So it's like in those times, it really allowed me to reflect on what's going on, but to understand what's going on and not really having the time to process it. Because like I said, life was moving fast, right? And so kind of trying to figure out who I was again in that process and to really figure out if I was healed from some things, if I wasn't, just that balance. And so ICWA, I actually worked in Grand Forks County for a year, Eastern North Dakota, right on the border of Minnesota. I was an ICWA family preservationist. And so basically I worked on the behalf of Grand Forks County, was an ICWA advocate for families. So I was there for court cases. I was working with social workers and child welfare workers throughout the duration of cases to ensure that, active efforts are being made, just really allowing or being the person that's holding the county responsible and holding them accountable to make sure that our Native people who are struggling are getting the services that, the state has to provide. And so that was something, it was a question of protection and belonging. And that was year ago or so. Ended up leaving that job right after I moved to Billings. But more than anything, this year really became about breaking generational cycles. And so right there on the right there, that's there's this post-bac program. So post-bac is a 1-year master's program. If you do well enough and you matriculate in medical school, well, I just found out this past, like last month or 2 months ago, that I had gotten into this program. And so very proud to say that hopefully if this year goes well, I'll be going to medical school and becoming a doctor, as well as my wife. She's a year ahead of me. But so that's something that's I'm looking forward to, but this is still connected to ICWA. So my role changed when I moved, but my mission did not. And so learning about ICWA, the Indian Child Welfare Act, it's sort of about protecting identity, belonging, and possibility. And so what my late grandmother provided for me was a place to heal, sort of like a sanctuary, a place to just be who I am and just to be, just to be a kid, right? Because I had to grow up fast growing up in the household I did. And so working alongside ICWA and working in that capacity, I really learned that how privileged I was to, be in a house that was full of culture and, my late grandmother teaching me all these things, whether it's discipline through chores, all of these things, right? And then being able to learn about that through ICWA and to be able to help the state and help families provide that for their kids, right? And so when Native youth lose like connection to the culture, that harm shows up in mental health too. And that's something I learned about myself in the past year is when things get hard, I fell into that old routine of really pushing my problems to the side, right? You have that idea of basically just being like, okay, I have this going on, I'll deal with it later. And later, really never comes. And next thing you know, you're just this big rubber band ball full of trauma, full of triggers, all of these things, right? And so I had to learn to really show it for myself in that point in time. But identity is not extra, it is part of wellness. And so I'm a big, cultural identity is something that's been very big for me. And I've always kind of known I'm Native American, given my last name. Anytime I go somewhere and I say myself, be like, oh, I'm Devin Hedress. And they're like, oh, yeah, you're Native, right? And I'm like, yep, right. And I'm very privileged in that sense because I do have buddies who have non-Native last names who are Native and, they have to fight that all the time. So it's a gift and a curse at times, but Native youth behavioral health has to include belonging. And so, like I said, what my late grandmother provided for me is something that when I was in that equal role or in the role I am now, to be able to speak to Indigenous health people like yourselves, like advocates, to include that culture is such a big thing of overall Native wellness health, especially Native youth. And so there's my son right there on the right. That's Casey and I. So my son changed this mission. So becoming a father made this work personal in a new way. It really started to make me think about what kind of house is he living in? What is, his story or the capabilities of what he could be, in his future? Am I providing those things? Am my wife and I being a team and providing these things? And so first thing I thought was, okay, is there stuff that I'm bearing underneath? Like I said, the past year is stressful. Obviously have childhood traumas, all of these things. And so I'm starting to think like, okay, am I healed from these things or did I suppress it? Is it going to show up later? And how's that going to affect my ability to be a dad, right? I didn't grow up with a father. And so all of this stuff was completely brand new to me. Understanding that anything that really came up or anything that really, reflected on my upbringing was a trigger. And I just didn't want that to show up in my parenting for my son. And so I started asking myself what kind of man and father he needs me to be. And I know that's different for every child. I'm not going to sit here with an ego and be like, I'm going to raise all my kids the same way and all these things because we all know kids come in the world with different temperaments, all of these things. And so you kind of have to learn parenting and adapt on the fly. And so he made me face my unfinished work more honestly. And so understanding that, like I said, didn't grow up with a dad. So in response to authority, I didn't respond to that very well because I wasn't used to it. Or, I wouldn't look at it as a source of discipline. I would look at it as oh, someone's getting mad at me for something. And instead of taking correction, I would just start firing back and, that whole thing. And so my son really changed the mission from purpose to daily responsibility. And by being not only trying to be a great husband for my wife, but being like a great dad for my son, literally just an everyday sense of purpose, right? And we live in a day and age where, there's that social media tells us exactly what men are supposed to be, right? The quiet, silent, bury your problems and all this stuff. Where I grew up in a house in a matriarchal household where that wasn't the case. And so still trying to figure out what kind of man I am, what kind of husband I want to be, what kind of father I want to be in today's world has honestly been a struggle, but it's like I said, it gives me purpose to strive to be better every single day. So, like I said, I had a lot of stuff, and when my son came into my life, I was really looking for something to, something to pursue. Not only, I was pursuing to be a better father for him and to be a better husband to my wife, but I want it to be like, I come from athletic background. I played collegiate basketball, all this stuff, played basketball my whole life. And so I always kind of needed something to keep me going, something to chase like athletically. And so I decided to do ultra running. And so right there on the right is when I was running in Cody, Wyoming, with the mountains in the background. And I was running a 50K. So I was 31 miles through the mountains there. And so ultra running really gave me a place to process, honestly. And so when I ran my first race, I ran it in Whitefish, Montana. So, Western Montana, these giant mountains, all this stuff. And I just remember just like getting halfway through the race and I was just completely nuked my energy, all this stuff. And it's in those moments when you're really struggling and there's no way out, you really have to face yourself. And I really just learned what I was suppressing, what like I was exhausted, just from parenting, having to be really brand new in my role as a father, having, not having that example to grow up with to understand this is how you be a native dad, because like I said, culture belonging is such a big part of this. Um, and so really facing those wounds and those scars. But it did give me discipline, structure, and somewhere to tell the truth. And so every day, just trying to keep myself honest by getting a workout in for this race. Like upcoming in 2.5 weeks, I'm running a 100-mile race in the Black Hills. And so it's literally just been months upon months preparing for that, which has been nice. But it's something that's taught me how to stay present in discomfort, right? I grew up in a house with my late grandmother telling me, how you do one thing is how you do everything. And so if I'm not approaching discomfort or if I'm just running from discomfort, there's something there. There's a root source there, there's a root cause that I have to deal with. And so ultra running has allowed me to come back to that, to understand what's the root cause and try to address it head on. And so it really helped me meet myself without distraction. And so when you're in these races, I don't listen to music or anything when I run or like when I run in these races is because I want to be completely where my feet are, right? And that should go for everything in everyday life. I want to be where my feet are. And so it became one way I practice becoming better, not only mentally and emotionally, but physically and spiritually as well. And so on February 14th, on Valentine's Day, I got into this race called the Black Canyon 100K. So it's 62 miles, right? And literally it's in Arizona, Phoenix, so burning hot sun in February. And coming from the plains where I'm from, like I said, I'm used to cold weather, all of these things. So I get to mile 49, and I was just physically, emotionally stripped down. I was roughly 12 or 13 hours into this race already. We're at the top of this mountain, and this is where the aid station is, see all the other runners and all this stuff. And I was really just like touch and go the whole way, where you can look at it from a perspective or a lens of like, hey, you're already 49 miles in. What's another 13, right? But in my brain, I'm like, yes, I am 49 miles in. How am I going to do these last 13, right? And I get to the aid station, and there's this older lady that came up to me on the trail. And when I was running on the trail, she was like, wow, you just keep coming back, right? Because like I said, I was touch and go the whole race. And she was just really confiding in me, right? Just being like, wow, you just keep coming back. Like, congrats, all this stuff. Just this older lady. Anyways, I'm sitting at this aid station at mile 49, and I'm like looking off in the distance, and I'm like, how am I going to have more energy to finish this and see it through? And the older lady, the voice in the dark came up to me, and she was like, hey, you've done 49 miles already. There's 13 more. Even if you just walk this in, you're going to finish on time, right? She's really confiding in me. She had her daughter right next to her who was just smiling, being like, wow, my mom's really having an impact on this kid. And in that moment, I felt like, spiritually speaking, I felt like it was my late grandmother Juanita, like speaking through her. And so she basically was like, you come this way, you keep fighting, you keep coming back, you can do this. And then she asked this last question that still sticks with me today. She said, are you coming? And I said, let's go. Right. In my head, I'm like the typical movie Rocky montage where I'm like, I can tackle anything, I can conquer anything. Right. And so in that moment, it felt bigger in the race, but it felt like a question about my life of being like, I'm going to keep getting beaten down. Scars and triggers are going to come up, but it only matters if I keep getting up and keep showing up there for my son, keep showing up for my wife, just keep showing up for myself, most importantly. And so it reminded me in that moment when I think about this race, and I ultimately finished, which I'm very glad, but it reminded me that so many young people are asking that same question is, am I coming? Am I capable? Can I do this? Right. And so the finish right there, Finished in 16 hours, finished right at midnight. So we started at 8 a.m., finished at midnight. And so the last 12 miles, I felt like a man on a mission. I was running like 8:30 pace up and through the mountains, 8:30 per mile, and literally ran the best that I ran the entire whole, like first 49 miles, I did not run nearly as fast compared to these last 12 to 13. So I was just really felt this source of, or this spark of energy from that, older lady, her and I's conversation. And so this is in the pitch black. I finished in 16 hours. I want to finish under 17, which is the goal. And so I was very proud of that. And as you can tell, I look sunburnt. My hair is all greasy, right? And I'm like holding on to all my gear, just wanting to be done. But, and so what still holds from this past year? I learned that boundaries matter because they make trust possible. And so, what do I mean by that? So, coming from a Native family, right? From Native families, it's really like there's the hierarchy of elders and then just age down, right? And so, understanding that when my wife's mother or my mother come into the picture and they're trying to help, being able to set those boundaries of being like, hey, we're trying to keep our peace here in this house, please don't bring any of your issues and bring them over here. And that's going to affect, my wife and I's ability to co-parent, but also just be husband and wife. So really setting those boundaries in this past year is like what's really allowed my wife and I to confide and trust in each other even more. And before I start again, right there on the right, that's Russell Means and my grandma Nita. They were doing an interview for PBS on the Cleveland Indians and the Washington Redskins logo. You could probably find that online if you just look up Juanita Helfrey. But I learned that partnership matters more than trying to be the savior. So this actually goes back to my ICWA work. I think a lot of times child welfare workers come in with this idea of, I need to come in and fix everything. But the whole idea and what I learned through this is we all as people, especially as Indigenous people, we carry this sort of power within ourselves. And so carrying this power within ourselves means that sometimes everyday life can get in the way of that. Just like I said, what I went through, right? Understanding what I was suppressing, understanding that everything that was in the way, and being able to have partnership in your work and in your job and in your profession. It's understanding that you're giving power back to these families. You're helping them see who they are. You're helping them see what they're capable of, right? Just like I said, I saw through my purpose of being a father, a first-time father, being a husband for the first time. I come from a family where not many people get married. Showing how powerful I was able to be seen through other people confiding in me and seeing that within myself and helping me find that possibility and help me find that capability. And so families carry power, memory, and medicine too. And in Native country, we speak about medicine, whether it's, people think about, sage, smudging, all this stuff, but we consider medicine of like your mental health as well. That's medicine too. Someone being able to come up to you like that older lady came up to me and confided in me and told me like I'm capable and all these things. That's medicine, right? And so learning that healing is possible even when it is slow and uneven. And one thing I really learned was I'm very much a person, like I said, I come from a sports background. My late grandmother is very strict on discipline and chores. And so I'm like, when I find one thing that works, I really want to stick to it, right? That's not possible when you become a parent, right? Every day is a new day. My son will wake up at 2 in the morning, 4 in the morning, 6 in the morning. It's kind of hard to get 8 hours of straight sleep when you have all of that going on. And so learning how to heal through those things and learning how to become really just a new version of myself, because I'm not going to be who I was 2 years ago, 3 years ago when I thought life was going good. I'm here now and learning how I'm literally just right where my feet are and what can I do to be the best possible man that I can be right now, the best possible husband and the best possible father. And I feel it goes in that order because when you and your wife aren't on the same page, it really affects your ability to parent. So I really believe that your spirituality comes first, then your marriage, and then your kids, right? And sometimes that can get backwards and all this stuff, but healing is possible. And so how does this correlate to youth work? Youth work should strengthen people and not center child welfare people or ICWA as heroes, right? Because when you give power back to these families, you're understanding that when child welfare is not involved anymore, that they're capable of handling their own issues, that, what you taught them, whether it was regulation or whether it was seeking help, whether it's psychiatry or, putting food on the table and all these things, they're going to be capable and know how to do those things because you showed them the tools how to do them. And they're not going to look at you as like a savior or a hero that anytime something gets hard, they need to come to you. And that's why it's so important for your work to not only work with the youth, but to show parents and all of them that they're just as capable of doing the things that you're capable of showing them how to do. And so what this year has taught me, fatherhood taught me my role is not just to provide. It teaches me to listen better and stay present. And that's something I'm still working on a daily basis, right? Uh, my wife will tell me, hey, I'm dehydrated. She's still breastfeeding. So she'll be like, yes, I'm dehydrated. My first thing is to be like, here's a water, here's electrolytes. I'm trying to solve her problems, right? And then what she wants from me is just to, listen and create the space for her. So, and staying present for her to show like she's not only like, I'm not only hearing her issues, but I'm also just being there for her, which is something she's done for me and which is something I really need to work on. But it taught me how to stay soft without becoming weak. And I put the quotations on weak because I wanted to put that in there because a lot of people use that in today's world when I don't think there's an idea of being weak. It's more or less just not having the capability of handling a situation. And so staying soft is, I coming from a res community, right? It's people have this misconception that being a man is someone that's hard, that's quiet, that's prone to fighting, that's prone to all of these things, right? Whereas the real alpha males, if you look in nature, you look at it's a lion, right? A lion when they become a father, a grizzly bear when they become a father, all of these things, right? And showing me that being that way or being, staying soft of being like, what do I need to be for my family? What do I need to be there for myself is the most important thing. It also taught me that showing up consistently matters. So, like I said, I grew up in a household that was very complicated, that was very, on edge, where things weren't consistent, whether it was my mom coming to my basketball games, right? And she really struggled with substance abuse, like I said. And that's something I could dive into in a whole nother thing. But just to show up for my son, to show up for my wife, to show up for myself, that's what the most important to me. And so young people often feel our presence before they trust our words. And so every time my son, whether he needs something, whether he wants me, to bring him to his mom to be breastfed or anything, any way I can help, right? He knows that mom and dad is going to show up. And that's something that I didn't really grow up with. They show up for me now. My parents show up for me now. But like just growing up, they weren't like that. And so I want to be that for my son to be like really create that secure attachment style with him, to show him confidence and to show that like, you can come to dad about anything. You can come to me no matter what your issues are. And so there's my son on the right, and then there's me on the left in this picture. And so why your work matters. So everything you guys do and why you guys are here, and I really appreciate you guys showing up and listening to me, matters to kids like me. It matters to kids like my son, right? Because if it wasn't for child welfare and all this stuff really stepping in and my late grandmother taking me in, who knows where I would have ended up, right? And who knows, that would have directly affected not only me, but affected my ability to parent my son, right? And it matters to multiple generations. And I think that's something that Sitting Bull, the Lakota leader, my wife's hunk papa, so I read a lot of Lakota books. He spoke about children are the most sacred thing. Children are the most important thing because, how you parent them and how you bring that up, it shapes their identity. It shapes hope, right? It shapes what feels possible for them. And if you show them that, life is going to be hard, there's going to be challenges, there's going to be things that come up, but you have me, and my job here as a parent is to equip you with those tools, or not even as a parent, but as a child welfare professional or working with youth. You have to show them what feels possible by picking them up when they fall down and then showing them the way when they get lost, right? Because when child welfare, and in my experience, when child welfare and all this stuff gets involved, it's just a family that's lost. And I've seen really great cases of people finding their way. And it was like just the most biggest sense of pride, right? And it shows what feels possible, just like my late grandmother, just like the work all you guys do. And so in closing, I'm still becoming the person I needed growing up. And so this is why I care so deeply about Native youth. And not only is it like a personal mission to ensure that, my son doesn't have to grow up the way I did, but to utilize my platform on social media, whether I'm like speaking to the camera, all of these things, or speaking in events like this, to tell little bits of my story and my takeaways with hopes that you guys meet a kid that may be similar or have a similar upbringing to mine. And you're going to be like, hey, you know what? This kid's not a lost cause because look what happened with Devin, right? And it shows like it just gives you purpose and it gives you a reason to keep fighting for the youth and to keep showing up for them. Because young people need adults who communicate steadiness, dignity, and safety. Because a lot of times you grow up in households that aren't very safe. And so if you can be that for them, someone that's going to stand firm, someone that's not going to run away when it gets hard, or someone that knows the tools to be able to help them so they can become a better functioning adult. And so they don't have to grow up the way that they do or continue or think that their scars are who they are. That's the most important thing. So our presence can help protect a young person's sense of future. And healing can begin with you when youth meet the kind of adult that they needed. And so that's why I wanted to name our presentation, I'm Becoming the Person I Needed Growing Up. And thank you guys for listening to me. And if you guys have any questions, please just shoot them right away. Thank you.
Thank you, Devin. I'm gonna let folks see if there's some questions. I have a question. So I was able to meet you through UND, the Indigenous Health Program. And I'm just wondering, I mean, you do so much with your running, being a parent, being a good partner, being in your community and spaces, speaking. I'm wondering if you could maybe talk a little bit about how you juggle the priorities, including your education. Kind of what is your mentality when things get really overwhelming or difficult? Maybe even some like tools that you utilize and kind of, the prioritization of all of your goals that you have.
Yeah. And so that's a really great question. And that's like something I still really struggle with, right? So this past semester wasn't my best semester in terms of like coursework and all these things, right? I had something come up with my father, something come up with my mother, just like a lot of family issues. And so I think our first thing, especially with people who come up in these households that, like I said, it's very, whether it's domestic violence, all of these things, right? Our first thing that happens when we don't learn to confide in other people, we tend to isolate. And so when hard times come up, sometimes I fall into this hard pattern of just thinking like, I don't want to put my issues on other people. But in those moments, that's exactly when I should be confiding in family and my wife and all that stuff. And so prioritizing all of that is to make sure if I want to hit my professional goals, I have to be there for myself personally. And so, okay, I look at it, I treat my spirit, I consider my spirit, right? I treat my spirit, whether it's through physical things, right? And so I want to consider my ultra running. So am I getting running or exercise done sometime in the day? Okay, I showed up for myself there. All right, am I carrying anything mentally or emotionally? Are my wife and I on the same page? And so her and I will talk and I'll talk through whatever's going through my mind or whatever's kind of just going on right now that's affecting my ability to parent or something, right? Right? Whether I have like a sort of like short temper, right? Where I'm just not regulating as easy. And so prioritizing, my physical health, my mental, emotional health, and my spiritual health all kind of comes together. And so the tools that I'd really give people in that sense of being like, I would say, allow other people to be there for you. Allow other people to step in. Like I see a psychiatrist and then I'm going to meet with a trauma therapist, right? And that's where I told you that the work on my trauma, my triggers is never ending. And it's something I'm going to work on the rest of my life. And it's not something I could control growing up, but it's something that I can work on now. And so it's being able to seek help out when you need it. And so relying on others that you trust, relying others that are there for you. And so really just being a good relative to yourself and others. And so, like I said, the whole point of what I'm trying to say is what the priority is. You need to show up for yourself if you're going to show up for others. And you can't pour into others if you're not pouring into yourself.
Thank you.
Yes.
I'm gonna give it another minute. Oh, it looks like Jade has a question.
Hi, I'm Jade Failing. I am on the Fort Peck Indian Reservation,
Mhm.
tribally enrolled member. I'm working
Yeah.
with the Crisis Coalition, and my question was kind of not pertaining specifically to your content, but asking you, and maybe if you want to send me your email or however that works, but one of our visions for a youth conference we have coming up is to have some quotes and just kind of inspirational pieces of information for the youth to see. And there were so many pieces in your presentation that would make amazing quotes. And of course, with giving credit to you, and you had a couple even by your grandma Juanita, that
Yeah.
we would be honored to use if this is something um, that would be possible. Please let me know. I think that they
Go right ahead. Go right
awesome,
ahead.
awesome. And I can get you more information on that and kind of show you what that vision turns out to be too, because these
Sweet.
quotes
Yeah.
I think are really going to be incredible for us. Thank you.
Yeah. Thank you. Yeah. My dad's from Fort Peck, so really close roots there.
Right. Are there any other questions? Anybody that wants to raise their hand? Well, Devin's here with us today. Yeah, it's a small,
Yeah.
small world.
Yeah. There's plenty of native country is so small.
Yeah. Well, Devin, I have one question, not to hog
Yep.
all the
Go for it.
questions.
Go for it.
But you, towards the end of your presentation, you talked a little bit about how, your parents show up for you now, and maybe
Yeah.
that wasn't the case as you were growing up. And, with as much transparency as you want to provide, could you explain maybe ways that maybe difficult conversations took place and how you are where you are now with them?
Yep.
Like, did that happen as you were growing up or just when you became a dad? Because I think, looking back on my life too, I think that's really important to kind of
Yeah.
identify when and how those tough conversations with our oftentimes parents
Yep.
can take place in our healing and how it helps our healing.
Yep. And so I would say definitely. So my mom really, like I said, she struggled with substance abuse growing up. And so she actually, when I was in high school, went to prison for 2.5, 3 years. And so when she came back my senior year of high school, we were able to have those hard conversations of being like, and I still had a lot of healing to do myself, right? I was a little standoffish with my mom at the beginning, but to see like, just see her really transform and to put her work into recovery and being of service to others, right? And it allowed us to have those hard conversations of being like, hey, like I went through this growing up, I went through all of this. And my mom was really someone that created the space for that, for us to talk our differences out and to really be like, sort of apologize to one another how what transpired, what happened, and to really face our scars head on. And so that's something that my mom and I had very early on. That's something my dad and I still struggle with. So my dad and I really struggle with talking to one another in a sense of, I think my father's about a year or two clean from alcohol, but those tendencies of like, how he used to show up as a parent still are kind of there, even though he's sober now. And so him and I have had those hard conversations, and it's unfortunately one of those things where it's like right now we're kind of butting heads, but it's not my lack of like wanting to speak with him, but it's more or less on his end. But I kind of find some peace in the sense of being like, I've done my part and I'm doing all I can to really try and speak to him. And if he's not open to speaking to me or being honest about things, then that's something we'll tackle further down the line. And so, yeah, I think those hard conversations are definitely worth having because it's not only necessary and to forgiveness, right? Some people, I'm one person, very hard-headed, so it's hard for me to forgive people. Uh, it's you don't, and I learned this growing up from my grandma Nita too, and she really modeled it. She never said it. Was or she would basically forgive others, and when you forgive others, even if that doesn't mean you guys have the same relationship as before, but it allows you to not carry that sort of grief in your heart and that grief in your spirit, and allow you to really come to peace with it and let it go. And so that's something that I've showed up with both my parents, like I said. it's having those hard conversations. And I think something we really struggle with in Native country is communicating and speaking to one another. And so just doing more of that.
Thank you for that.
Yeah.
Well, we appreciate your presentation, and it looks like Devin put his email in the chat for those that are maybe interested. But at this time, again, thank you, Devin, for being here. Appreciate your story and your motivation, and just your presence in the community. You mentioned your social media. If you don't know Devin on social media, I don't know where you are. Maybe you're not on social media.
Yeah.
Devin's TikTok famous.
Yeah.
So
Yeah, I guess.
so give him a follow and hear some more of his story. But thank you for being here. And at this time, I think we'll move over to Joanne to introduce Frank Wong, who is here and who will close us out. So what's going to happen next is we'll do an introduction of Frank. Frank will spend time with us giving his message. And then Chris Tallbear will be joining us again to close us out in prayer. And then you can go enjoy the rest of your day. So go ahead, Joanne.
All right, awesome. Thank you so much, Chelsea. We are excited to welcome Frank Wan, an award-winning Lakota artist, songwriter, and educator. Through music, storytelling, and cultural expression, Frank explores healing from historical trauma while uplifting Indigenous wellness, identity, and resilience.
Thank you so much. Mitako yapi, oyate tchecha omani amachapelo, naha iuha chante washte anape chuzapelo. Hello, relatives. Thank you for that beautiful introduction. I just introduced myself in my language. I'm Lakota. I said my Lakota name is actually, in English, it translates to walks with the young nation or walks with the new nation. And believe it or not, I really believe that that name is part of the reason why I am even here with you all today. You all are young people. You all are the new nation. You all are the young nation. And I got that name from my home community and ceremony. When I was very young, I was like 19, 20 when I got that name. And in our culture, we believe that your Lakota name is sort of like your life path. And I actually got that name before I even left my res with my music and my art. And today I'm going to be talking to you all about the power of music. And what I'm going to say about music can also be applied to art. So really it's going to be like the power of music, but the power of art on a more wider scale. And so I was given that name when I was young in ceremony back home, and it kind of set me on this life path. And whenever I got that name, I decided any opportunity that came my way, especially through music, because I was trying to build a career and a path with music, any opportunity that came my way to work with young people, I would say yes, you know, especially if it felt right, and it always felt right. And I was even working with young people when I was a young person. I got my first jobs through tribal programs, Sichungu Nation. I'm from the Lakota Sichungu Nation Employment and Training Program. I got my first job when I was 12 years old through a tribal program, started working as a janitor's assistant for minimum wage, and I started building up money so I can invest in a home studio. So that's going to be a part of my past. So what I'm going to do today is I'm going to talk about the power of music, and I'm going to share some stories that are examples of the power of music in my life and just some experiences I've had, because music and art in general, like I said, is such a powerful tool. Music has allowed me to get an education, and I'm going to talk about that. Music has allowed me to build a career and a life path that was different than anything I've ever seen done before in my family, and you know, is even bigger and better than I could have ever imagined. Like, music has taken me places around the world I never thought I'd go. Like, I grew up, I was just a res kid in the middle of nowhere, South Dakota, who had this dream and had this passion for music and playing instruments. Started working these summer jobs to build a home studio, to start teaching myself to make music, produce music, and record music at home. And later on, you know, pursued music production and higher education. I'm going to talk about that too. But before I talk about those stories, I want us all to just kind of think about the role that music plays in your own life. Like, think about the power that music has in your own life. And I feel like maybe I'm over speaking, but I can say as a native person, I feel like especially all the native people I know, and I've been around the world at this point, but a lot of the native people I know are deeply connected to music in different ways, whether that be, you're just an avid listener and you have music that you love and music that you always listen to, or you participate in music and maybe you sing ceremony songs, maybe you participate in powwow. The other beautiful thing that I want us to think about, and maybe you already view music this way, and if you haven't, you can start thinking about it today, is that music plays a lot of different roles, not only in our lives, but like in our world and in human culture, not just for natives, but for humans in general. And I've also learned that music goes beyond just humans. Animals and nature also participate in music, so the power of music goes beyond just human beings. It's actually been observed in nature that whales will sing songs. Whales will actually compose songs with distinct melodies. And I don't know if you know this, but whales have really strong emotional family bonds like humans do, like natives do. They got big families. And whales will actually compose songs with distinct melodies and teach those songs to other whales in their family and community. So it's also been observed that music goes beyond just humans. Like music exists in nature, music exists in animals, even birds sing, so I want us to just root ourselves in the universal power of music, and that music is just like a truth about our world and our existence, and human beings and your own deep connection to that is connected to that, so just know that music is such a powerful tool, and that even animals use it, and it goes all throughout our world. It's a universal language, but it also is deeply connected to us as human beings. So like I said, think about your own connection to music. And actually, I'm going to also talk about how I used music and education to build my life as an artist, because, those two things are really weaved together for me. And I spent the last 2 years teaching in the School of Music at Western Michigan University. I taught music production classes because I have a degree in music production. I started with my little res studio from my summer jobs, and I went and got a degree in that later on. And now I teach that at a university. And then native music history courses. And we have discussions like this about the role music plays in our lives. And I know for a fact, all of you probably have your own personal connection to music. So think about your own connection to music, and think about, is there a song or a playlist or an artist that you listen to whenever you want to pump yourself up and hype yourself up? I always had that. I grew up on a res that was really big into sports. I come from one of the biggest sports families on my res, and actually won a state championship in basketball when I was a senior. And music was a big part of our basketball team, and it was a big part of our basketball community, even down to our state champion team. We went to state 3 years before we won a championship. And after my senior year, when we won a championship, my school went back to not just the state tournament, but the state championship for 8 years in a row. We created a dynasty. My little cousin, they won back-to-back years in the middle of that. But music was a huge part of that for us, because we all loved music. We were all res kids. We loved music. And we created our own team playlist. And we actually burned it on a CD, and we would use that playlist to work out when we were in the gym. We would use that playlist in practice. We would jam it in our cars, and on that playlist we also had the songs we would run out to. So it was like music is this thing that created another level of bonding for us as a team, and another level to come together. And like I said, we had songs that hyped us up, got us going in the weight room at 6 a.m., got us going for a game, got us going for the state championship. So I'm sure you all probably have your own similar songs, artists, and playlists like that help get you going. So in that way, music has a power to give us energy. Also think about, for me, and maybe this isn't true of all of you, but this is definitely true of me. I'm super deeply connected to music, but even when I'm sad, I have certain songs that I listen to help me navigate through times when I'm sad, times when I'm struggling with my mental health. And I was using music in this way even before I heard terms like mental health, because whenever I was growing up on my reservation, we were going through a lot, and I really connected with the presenter before this, mirrored a lot of some of the experiences I had growing up, and music and sports were the two things that really anchored me through all of that, And so think about the role that music has in your own life, and how music has the power to rewire our brains, to give us energy, to wake us up, to get us going, to help us get through a hard time. And And on a deeper level, I'm grateful that I grew up in a reservation community where I was able to participate in ceremony. I started participating in ceremony when I was in middle school, and I got called to the drum. And just before that, I was in a Lakota drum group. The elementary school I attended on my res had a drum group, and I wanted to join that drum group. The first chance I got, had to be in 4th grade to join. And I asked my mom to put me in the class with the drum group because I wanted to be in the drum group. And so I was already singing, different Lakota songs, traditional songs. I was in this youth drum group. And then when I started going to ceremony with my family, as my family started attending ceremony more, I got called to the drum by, the people that led the drum at the ceremony space I went to, and started learning ceremony songs and started connecting to music in that way. And that's a whole other connection for us as Native people, and how music is weaved throughout our cultures, throughout our histories, throughout our families, in a lot of different ways. And so I'm sharing these stories to let you all know, in my 20s, I kind of made my name as a Native rapper, but that was just a piece of it for me. Like, that's one piece of the music and one piece of the story, because for me it goes back to when I was a kid. It goes back to the ceremony drum. It goes back to me teaching myself to play piano. Whenever I was in 2nd and 3rd grade, I started teaching myself to play instruments when I was young. And I did all of that because it just made me feel good. And I can share this with young Native people because we all have beautiful gifts passed down from our ancestors. Our ancestors were artists. Like, I grew up in a family, like I said, they were big into sports, but they were really big into rodeo too. And I was a bit of the odd one out in that I wanted to do music. I wanted to be a musician. I wanted to build a home studio. I was into sports. I'd help my family with the ranch work, but I really wanted to do music. That was like my passion. But I can see in my family that all of my family members, I think, are artistic and creative, and I could see it in different ways. So I know, and I come from a real big family, so I know for Native people, we have all these gifts passed down from our ancestors, intellectual gifts, physical gifts, and also creative, artistic gifts, spiritual gifts as well, I think. And for us as Native people, I bet some of you listening out there probably have different art forms. Maybe you like to draw. Maybe you do like music. Maybe you do like playing music. Another thing that really helped me that was connected to music was poetry. When I was in middle school, I really got into writing poetry, and that's actually how I started writing songs. So I was teaching myself to play all these instruments by ear, playing piano. I was in the Lakota drum group, and then when I got into middle school and high school, I was in pep band, and I played drum kit and pep band. So I was just like absorbing music any way I could and participating in it any way I could, because I loved it like I love sports. I loved it like I loved basketball and running. It just made me feel good. And I'm a little bit older now. I'm a millennial. I'm 36. We didn't get internet, like working, functioning internet on my res until I was like 15. So it's really hard to imagine, but imagine, you didn't have your phone, you didn't have social media, you didn't have internet, you didn't have a way to connect with the world. And so back then, music, sports, poetry, things like that was what I connected to, because that was what was around me and what I had coming up on a very rural res. I grew up on the Rosebud Reservation. It's in the middle of nowhere. It's very rural, it's in rural South Dakota, and we didn't have much growing up, but we had basketball, we had sports, we had culture, like I shared. I was able to participate in a cultural drum group that really, I think, informed my journey as a music artist. So from a very young age, music has always played a central role in my life. And honestly, I didn't realize that I was different in that, like, everything I was doing was about music. I love sports too, and I was doing sports as big as I could, but I would always bring it back to music. And I realized that I had a brain wired for music. So I know those of us who are artists, wherever your art is, maybe you draw, maybe you're a filmmaker, maybe you're a musician, you might have a brain wired for that art. You might be able to see colors or kind of hear sounds in a different way, and that's a part of being creatively gifted. So I encourage any of you to explore those things, work on them by yourself every day, whatever your practice is. For me as a musician, and I always get asked, like, what's advice you have for young musicians or young people that want to make it in music? And there's a whole presentation to be said about that, but at the root of it all, you need to practice every day. Whatever you want to do in life, this applies to art, but for me, this also applied to sports. And this was how we became state champs, is we worked at it every single day. So I was grateful that I had that around me, because I applied that to my life when I got older and left my reservation. So like I said, when I was young, music was around me. I sought it out. I was in pep band. I was in a Lakota drum group. I started working summer jobs and building up a home studio. And I started teaching myself to produce music on my laptop, to make beats on my laptop, and to record music at home. And I'm so old that my generation, me doing that as a teenager, was the first time that you could actually make music on a laptop. They're called DAWs, DAWs, Digital Audio Workstations. And at the university I teach at in the production program, that's what we teach about. We teach about how to work a DAW. And when I was young, and I was like 12, I got my first DAW. And this was when these things first came out in the early 2000s. I taught myself how to work a DAW with, no mentors, no one around me, just kind of figuring out as I went. And so that's why I tell people to practice. Like, it's good to have mentors, and if you want to pursue like education in whatever field, but you also need to work on it on your own time, and you need to create your own dedication to whatever your craft is. And for me, when I was young, it was like music and sports was the two things I focused on the most. And just like on a wider scale, I was growing up in a family in a reservation where there was a whole lot of negative influence around me. Like, I could have been spending that time that I spent with music and sports doing some other negative stuff that could have took my life in a whole different path. And I don't look down on anyone that did that, because I grew up with so many cousins, and a lot of them took that path. And some of my cousins ended up locked up. Some of my cousins aren't with us anymore, and it breaks my heart. And I could see back then that where our lives started branching off, and they started going in this direction, and I started going in this direction because I had healthy things to focus on, things like music and sports. So I encourage you all to find your own connection to things that make you feel good, things that help you connect to yourself. Music also helped me connect to the universe, I realized, in different ways. Ceremony songs really helped me connect to spirit at that time. So whenever I was young, I used music to kind of navigate my life, and I still do that to this day. And so I can look back in my life and I can see where I started doing that at a very young age, and that was something that made me different too. And I was always kind of different everywhere I went. Like, I fit in, but I was also different. One of the ways I was different is that I was super dedicated to music, even from the time I was a young age, building a home studio. So I encourage you all to invest in yourself, invest in your passions, invest in your craft. And, you got to start with yourself, and then along the way, other people will see that and invest in you as well. And so I talked about how I use music with my mental health too. Writing poetry and writing songs helped me navigate when I was down and sad, even when I was young. Even before I had the word mental health, I was using music to help me navigate my own mental health. And so whenever I graduated from high school, I was valedictorian of my class, and I received a full ride scholarship that would follow me to any university I got accepted at. And I eventually landed at an art school in Chicago where I studied music production, but that is not how I started. So how I started when I was 18, when I was maybe the age of some of you all, I didn't even know art schools for music production existed yet. I was that rural, I was that naive, I was that young, and I thought that the only way I could help people, and I knew like deep inside, I wanted to help people heal because I was like trying to help myself heal. I didn't know I could use music to do that. So when I was 18, I used that scholarship to go to Creighton University to study pre-med on an exercise science path, because like I said, I really love sports as much as music. So I was like, all right, I'll do sports medicine. I'll become a sports medicine doctor. I'll try this out and see how it is. So I spent 2 years at Creighton doing that, and I got good grades and I was on a good path, but it felt empty. Like I felt empty inside doing that. Like it just didn't feel like it got me going the same way music did. But at that time, I didn't really believe in my music. It was something that I felt like I just did as like a passion project. I didn't even believe I could make a career out of it. And after 2 years at Creighton, and I was also going through some other really heavy mental health stuff at the time, I kind of hit one of the rock bottom points in my life at that time. And it seems like every time I fall down, like music's one of the things that's there at the bottom for me and helps me get back up. And that happened during that time. And also during that time when I was struggling with my mental health, I took a year off from school because I knew I didn't want to do the pre-med thing anymore, but I wasn't really sure what I wanted to do yet. I had 1 year to figure it out with my scholarship. And so during that year off, I actually set up my studio in my cousin's basement, and I produced my first like ever legit album. I was with a group at the time. I formed a group on my reservation with a couple cousins and my cousin-in-law from Virginia who moved out to our res. He's a rapper and a singer. And that album actually won me my first ever Native American Music Award during that year. I was the youngest ever to win Best Producer, and I won it. I got Best Producer for making beats on my scholarship laptop in my cousin's basement, you know, and I was just 19 years old. And I didn't even, like I said, I didn't even realize I could build a career with music at that time. Like we were just, like putting your music on the internet as a non-signed independent artist was something new at that time. Like it was just, like we were just figuring it out. It was the first time you could do that. And so it also became a powerful tool for an artist like me from a rural res to get my music out to the world. And in that way, you know, another way music and art can be a powerful tool is it helped me find my voice. And in the beginning, I just wrote songs about, you know, my life, like my mental health struggles. I wrote love songs, just things that I was going through as a young person, you know. And later on in my 20s, I'll talk about how the role music played as a tool for my voice even changed, because it feels like every era of my life, you know, as I've adapted, music has grown and adapted with me. And I'm sure this will be true for you all as young people. Like I said, I encourage you to find the things that you're connected to. Creative outlets, if you have those. I'm sure all of you will probably connect to some sort of creative outlet. Maybe it's sports, you know, maybe it's drawing, maybe you love poetry. I encourage you to invest in those things, because if you keep, you know, if you invest in your crafts, if you invest in your passions, it'll grow with you throughout life as well. And it'll always be there for you, you know, whenever you need it. And for me, music was always that thing. Because, you know, I love sports, but Uncle Frank, you know, your knees and your body started giving out after a while, so I couldn't just keep going with sports. It felt like I peaked at 18 after the state championship. It felt like my body started going down, so I had to invest in another way. But everything I learned in sports, you know, like the dedication, the waking up early, staying up late, just dedicating to a craft, driving a long way for a game or a tournament, I put all that to music, because, like, being an independent music artist is a grind and a struggle. It's not too different from being an athlete, you know, which is a grind and a struggle. I'm sure those of us that are athletes know what that's like. And so I applied that to music, you know, after Uncle's knee started giving out on him and stuff. I put all of that dedication and that energy I had towards building a career in music. And during that year off, I won my first NAMI, and I found an art school in Chicago that looked very interesting to me that I could use my scholarship to attend. It was called Columbia College Chicago. So in 2011, I graduated high school in 2008, spent a couple of years at Creighton studying pre-med, and then took a year off. During that year off, I just put everything I had into music, you know, and started getting booked for shows as well on my reservation. Different tribal programs started booking our group to perform. And during that time is when I got the Lakota name that I introduced myself with, Walks with the Young Nation. And looking back now, I can see it because I'm a little older, but, you know, whenever you're young, you're just kind of going and trying to build your path. But I could see that the elders in my community seen the way that I, as a young person, and all of my peers, the other young people on my reservation, were connecting to not just music, but the music we were making at home, you know, and the music we were creating at home. And like I said, just a piece of history, it was the first time in the history of reservations, my generation was the first time we could record music at home on a computer, because that technology became available to everyone for the first time. And so, you know, I was a part of that wave, and I was a part of that generation. I didn't realize it at the time, and looking back now I could see, but at that time, you know, we were using music as a tool to find our voice as young Native people. And me being a Native artist on my res that like set up a studio and was recording music on my laptop, I was not the only one. There were so many different groups. Again, I said I was a part of a group. There was like more groups than I can remember on my reservation. It was like all the young people were participating in the music culture in some sort of way. We were a part of some group. Even if you were a part of the group and you like barely said one word, or you were like the clown, you didn't rap or sing, or maybe you only rapped one time, like everyone started forming these different crews and groups, and we formed our own, you know, like I said, with some cousins and some friends. And so I was a part of that generation. And I used all of that to kind of fuel me whenever I found an art school in Chicago where I could study music production. And I was so, ready to do it, because at that point I had won some awards. I was getting booked to perform. I had recorded multiple albums and mixtapes on my reservation in my home studio with my group and others. So I was ready to go to Chicago and see where that led me as a native artist, And so whenever I moved to Chicago, again, I used my scholarship. So again, music and education, like I said, are just very weaved together for me. I can't imagine what my life would be like without music, also without education, because I used my scholarship to attend an art school in Chicago. So it paid for, my tuition, paid for my room and board, and it allowed me to move to downtown Chicago where the school was located, as a rural res kid that was coming from like a poor rural res. Another thing I forgot to mention is that another reason education was central to my life is I was raised by a teacher. So my mom, she was a single mother. My dad bailed on me and my mom when I was 3. And again, music was one of those things that even helped me navigate that, dealing with the pain of your dad not wanting to be a part of your life and just figuring that out. But my mom was just a powerful guiding force in my life. She's an amazing woman. She's a teacher. She was an educator. And she taught me at a young age. I'll never forget, like I have a core formative memory of walking with my mom. She is holding my hand on my very first day of school in kindergarten at Rosewood Elementary, and she was walking me up the long sidewalk, and she was telling me, like, you got to do really, really well in school, do your best, because you can use school to build a better life for yourself, is what she told me. And she would always instill that in me. So that was also why I used education as a tool to build my career and my path as an artist, because I was raised by a teacher who instilled in me the power of education. So I want to also share that with you all, that I wouldn't be where I am as a native artist or just as a person without education. So I encourage you all to learn as much as you can, as best as you can. And I want to also know, I know that our school system sometimes isn't built for the way everyone learns, because some of my cousins that I grew up with, some of the smartest people I know, barely passed high school, if I'm being honest, but I could see in them that they weren't stupid. The system just didn't work for them. And so education doesn't just happen in a school. Education happens in a lot of different ways. And the beautiful thing is, you as young people now have the internet, which is a powerful tool to learn. I use the internet to teach myself how to build a home studio, to invest in the tools I needed and get them shipped, buy them, get them shipped to my rural reservation to set up my home studio. So use these tools at your disposal as much as you can, because when I was growing up, I didn't have as many tools. And I want to now talk about how I use music as a tool for education, but also to find my voice once I was in art school. So I'm going to take a drink real quick, excuse me. So whenever I moved to Chicago to attend art school, one thing that I really struggled with that I didn't anticipate is being so far removed and disconnected from my home, from my family, from my culture, and from natives in general. When I was at Creighton University in Omaha, that was only like a 5-hour drive away from my res, so I'd go home often, and there was a lot of natives at that school, and there's a lot of natives in Omaha, so it was a different experience. But when I moved to Chicago, there's a lot of natives here too, but it's a big city, and I didn't know anyone. So I was just talking to someone about my education journey, and I was telling them how both of the universities I attended, Creighton University and Columbia College in Chicago, whenever I started out, I realized that whenever, my day one, I moved to the cities where the schools were, and I didn't know a soul every time. My mom would help me move, my single mom, she'd help me haul my stuff. I'd move in, and then she'd head back to the res, and I'd start out brand new in a city, not knowing a soul. So I did that in Omaha, and then I did that in Chicago. And I'm based in Chicago right now. I'm coming to you live from Chicago. I've been in Chicago ever since. So Chicago has become like a second home for me. But whenever I moved out here as a rural res kid to downtown Chicago, it was a big culture shock for me at first. Like, I didn't know anyone, but again, music, the power of music. Music was the tool that allowed me to meet people in Chicago, to connect with people in Chicago, to build a community in Chicago. And now that there's people native and non-native in Chicago that I consider relatives, and I've met them through music in some sort of way or another, whether that be an event, a performance, an artist coalition, art school that I attended, so music and art is also a powerful tool to connect with others. It helped me find my voice. It's a powerful tool to help you send that voice out. And whenever you send out your voice or you try to tell a story, your story, any story, you're connecting with people. So music was a tool for me to connect with people in every city that I moved to, but especially whenever I set out to make it as a Native artist. And so I attended art school in Chicago, and I want to share a story about how when I was attending art school in Chicago, I was in my early 20s. Music then evolved further and became a tool for me to share a very specific story. So like I said, until that point, I was writing my own personal stories through my music, and I was sharing it online, but I wasn't really sure what I wanted to do as an artist. I was still figuring it out. And all of that kind of got put on hold when I was in college because my reservation started fighting a pipeline being built through our res. So I'm sure, for those of us who are part of Native communities, that oftentimes Native communities and reservations are at the front line of land issues, sometimes it's connected to where they displaced us. So some reses, they put us in the middle of nowhere where they thought anyone would want to go, which is true, but oftentimes those lands are rich in resources and minerals. And also another thing is a lot of our sacred sites have a lot of resources and minerals. And so for that reason just alone, and colonization, Native communities are always at the front lines of land issues in America. And I didn't realize that at the time, even though I was coming from a community that was dealing with that. To me, it was just like what we were going through at home. It wasn't until I started traveling around the world sharing this story that I realized that the community I come from, the reservation I come from, has been on the front lines of a lot of issues dealing with Native history and colonization going back to the beginning. So also a part of me sharing this story with the world was just being born on the front lines of a lot of these issues and being raised by the people who, fought for the land and protected the land. And whenever I was in my early 20s, an oil corporation and our government were trying to build what was called the Keystone XL pipeline at the time, through the reservation I come from. They always do it this way. I don't know why they did it this way, but they routed it over our aquifer where we got our fresh water supply. And of course they didn't consult our tribal government. I don't even know if they consulted the state before they made the plans, but the state okayed it. And our tribal government and our tribal members were like the last ones to find out. And so it became a big issue for our tribe, and it slowly became known beyond our tribe, and it grew into what became the Standing Rock protest on the Standing Rock Reservation in 2017, where there were over 10,000 people camped out at a spirit camp up there. So for those of you, if you went to Standing Rock during that time, and I was there, it was like sectioned. It was so huge, and there were sections, and there was a section called the Rosebud Camp. And the Rosebud Camp was actually started by the people that started the spirit camp over where they were going to build on our reservation, the aquifer land. So it was like all these different spirit camps kind of came together for Standing Rock, and my community was one of the seeds that went and started that spirit camp at Standing Rock, because we had our own spirit camp on my reservation. And at that time I used my music to tell that story, and I did it because and again, it was one of those things I didn't realize it until a little bit till after it was done. But the people that raised me, the people I did ceremony with, so I shared with you all, and these are things I only share with Native people, talking about my connection to ceremony. I shared with you all when I started connecting to ceremony as a young person, and learning ceremony songs and sitting at the drum. The people the elders that taught me that, the people that invited me to the drum, the ones that I prayed with, were the ones that started that spirit camp. My high school basketball coach, the assistant basketball coach, was one of the founders of that spirit camp, and he was someone who I did ceremony with. So it was just super weaved into my life and my community. And it was like the people that raised me were standing up to stop this pipeline, were standing up to say something about it. And it got to a point where I felt kind of felt like I'd be a coward if I didn't join them, because it was like everyone that I cared about, everyone I loved, my high school coach, the people I do ceremony with, they're all standing up and joining this cause. And so I wanted to as well. And at the time I was in Chicago, and I couldn't be at home like I wanted to. And I'll never forget this day. I was in Chicago. I had classes that day, and I went back to my dorm, and I got on Facebook, and I seen videos being posted on Facebook from home of like one of our first protests before we even built the Spirit Camp. And what they did during that very first protest is they blockaded the highways coming onto our res, because they seen that the oil corporation started sending all the pipes and the tractors and all the gear and tools they were going to use to start digging and building that pipeline. And so they blocked the road and blocked all these trucks carrying pipelines and tractors and stuff from coming onto our res. All these tribal members, it's their res cars, man, and their bodies, they blocked it off. And I was watching these videos being made, and I was like, man, I want to be there, but I can't leave school because I was on scholarship, and I had to maintain a very high GPA to maintain my full ride scholarship. So I was also had to, remain focused on education. But I was studying music production. I had my home studio, and I was watching this protest take place at home. And this certain video was posted, and it featured this elder that I feel like set something off in my brain and my spirit and set me on a course that I'm still on to this day. So there was this elder, R.I.P., her name was Marie Randall, and she was one of the tribal members that was at that blockade, at that first protest. She was a 92-year-old woman, and someone got on video. She went right up to those trucks, and she turned around and she started talking to our people, and she was like, I'm 92 years old. I'm paraphrasing now. I'm going to try not to get emotional, but she was like, I'm 92 years old. I'm an old woman. I'm a grandma. She's like, I'm not going to be here much longer. This land, like this reservation, this is all we have. She was like, I'm going to be gone soon. You young people need to step up when I'm gone. Who's going to do this? I'm getting emotional. I'm sorry, because it still triggers me, man. It still gets me going, because whenever I heard that, I was like, I need to do something. And what I did is I ended up actually writing a lot of music about that issue, and it started a journey for me to realize how issues like my tribe fighting a pipeline, how that was connected to genocide and the colonization of our people. And at the time, like I said, I couldn't drive home, I couldn't leave school. So what I could do, I realized, was write songs about that as a young person. So I wrote a particular song called Oil for Blood. I filmed a music video on my reservation with some friends. But the music that I started making about that issue also started sharing that story with people my age. And it became a way for my tribe to share that story beyond just us and beyond just like videos of the protests, which work. But this is where art also plays a really awesome role in helping spread a message that is trying to be suppressed and from people that are oppressed. And I think for Native people, art has always been a powerful tool for us to share our stories, share our message, and let the world know about what we're going through. And that's what I did at the time. And actually my tribe, so it started out with just us, just our natives on our reservation. We banded with the other reservations where the pipeline was going, because they routed it through several reservations, and they also routed it through farm and ranch land in Nebraska for white farmers and ranchers, and they didn't even know it. So we actually collaborated with them, and we formed a coalition called the Cowboy and Indian Alliance. And so, when you think about cowboys and Indians, people think about their, usually enemies, but we kind of flipped that on its head, and we said these cowboys and these Indians are coming together, and also there's Indian cowboys, and we were coming together to stop this pipeline, because it wasn't just impacting tribal land, it was also impacting farm and ranch land in Nebraska. And the role that music played in it created a story that I'm never going to forget. So at the time when all of this was going on, I got an email from a Native lady who was a producer for a show that they were making for MTV. So MTV created this docu-series back then. It only existed online and played on MTVU and MTV2, but it was called Rebel Music. And it was episodes about music and culture and history and resistance around the world. But for season 2, they wanted to do an episode about Native American music, history, culture, and resistance in the US and Canada. And I was one of the artists that they profiled. So when I graduated from college and I got my degree in audio engineering, and I was making music about what my tribe was going through with this pipeline, I also was able to share that story on MTV's platform because MTV camera crews followed me around for several months, and we filmed a show called Rebel Music Native America. It's on YouTube right now. It's a 45-minute episode you could watch. We talk about the pipeline my tribe was dealing with. We talk about, mental health on the Pine Ridge Reservation. They also talk about MMIW because they profiled a native singer from Canada, a woman. Her name's Inez Jasper. She's a really powerful singer. So a lot of the issues that we're still dealing with today, we talked about in that documentary because we were talking about it in our music, so by using music as a tool to find my voice and then using it to talk about the things that were important to me, my home, that native grandma saying, you need to step up because I'm not going to be here long. Like, I'm 92 and I'm on the front lines. I'm like, you know what? She's right. If she can do that, I need to do something. And I put it into my music, and we formed the Cowboy and Indian Alliance. MTV followed me around and captured it, and it all culminated with a huge festival concert in Nebraska. So we called it Harvest the Hope Concert, and the Cowboy and Indian Alliance came together. One of the ranchers in Nebraska donated his cornfield, and they turned it into a music festival grounds. And actually it was headlined by Willie Nelson and Neil Young. So for you young people, you might not know who that is, but Willie Nelson and Neil Young are legends. They're icons, and they've always kind of used their music to talk about stories that aren't shared a lot. And they also are really connected to farmers and ranchers in America. So they came in through the Cowboy and Indian Alliance, the farmers and ranchers. And I was able to open up for Willie Nelson and Neil Young at the Harvest the Hope concert. So I still got the poster with their name and my name. I represented the Indian side of the Cowboy and Indian Alliance that threw on the Harvest the Hope. And there was over 10,000 people there in that cornfield at that festival who were there, and they learned about that pipeline. They raised money for it. And I'll never forget this, and this is in the MTV documentary. My mom's really shy. She's not like me. I'll get on a stage right now if I have to, even though I used to be shy, but I had to grow out of that. But I kind of snuck attack my mom because MTV was filming, and I have a song that I wrote for her as a birthday present when I was in college. So that same year, that same summer, I wrote the pipeline song. I also wrote a birthday song for my mom because I was dead broke. I wasn't making money off my music yet, and all I could do was make her a song. I couldn't buy her anything. And so at that concert, I brought her out on stage in front of 10,000 plus people and performed that song for her as a birthday present. And it was a moment I'll never forget, man. Like, my single mom, she was the reason I'm there. She's the reason I'm also super connected to land, because my mom was a teacher, but then after she taught, she worked in our tribe's tribal land enterprise office and the historic land preservation office. She's always worked with land in our tribe in different ways, so there's no coincidence. For those of you who know my work, you might see this. If you don't, and you go look at my music in my 20s, education, land, mental health, all of that's weaved into it because of the person that raised me and the community I came from, and how that made me the person I am today. And so that was another way that I used music to not only find my voice, but share a story. I talked about that pipeline issue. It became part of a larger story, became part of the larger narrative, and it became a way for me to help, and a way for me to like I said, when I seen that video and I seen that elder speaking, I felt like I had to do something, like I just needed to do something. And I realized that my something is music. That's my gift. That's what I have. I started to gain a platform. I could use that platform to share a story, to talk about the things that are impacting my community and natives in the United States and internationally. And I started figuring all that out when I was in my early 20s in college. And like I said, I graduated. I did the MTV docu-series. And I want to share one last story of how music became another powerful tool for me to help me heal personally. So, I just kind of shared the story of how I started out with music, from teaching myself to play piano when I was in a Lakota drum group, to building a home studio, being part of a wave of young native people on my reservation making music at home for the first time. And then when I moved to Chicago and my tribe was fighting with the pipeline, how my music and the voice that I had through music and the platform that I had through music became connected to a larger narrative and became connected to things that were happening globally. because another way that music allowed me to connect to the world is whenever we were fighting the Keystone XL pipeline on my reservation, we were able to get the Keystone stopped, but then that kind of just like morphed into that Dakota Access that we were fighting with the Standing Rock protest. So it was like that the Keystone XL fight kind of died, but it evolved into other things. And so as I was figuring out how to use music as my voice as a young person, and I got the MTV documentary, and it allowed me to kind of turn my music into a career after that. So, it wasn't just by chance. So I shared with you all how my journey with music goes back to, I feel like when I was in second grade when I started teaching myself to play keys, So by the time I got the opportunity with MTV, it wasn't just by chance and it wasn't just some overnight stuff. Like I got that opportunity when I was 21 and I felt like I had been working at music. I started building my studio with the summer jobs since I was like 12, So it was just like years and years of me investing into music, investing in my studio, putting my music online. And I didn't really know what a career like being a native artist could look like until I started getting more of a platform after the MTV documentary. I started getting booked more to perform. And also for those of you who want to be native artists, just know that there's a ton of great opportunities for native artists with different organizations. So another thing that I started doing during that time is I started applying for different grants for native artists. And whenever I was 21 and I was still in school, I got my first ever grant as a native artist with this organization called First Peoples Fund. They're based out of the Plains, but they have all sorts of different grants for native art and native communities. And they were my first ever grant. I was really nervous first time I got that. Fast forward now, I sit on the board of directors for that organization. I'm the youngest person on that board. They just had me join a couple years ago. So like I said, all of this stuff just keeps, growing and snowballing for me. But it is all rooted around music, and it all goes back to my dedication to music, and how that dedication to music for me is rooted in the fact that I know that I'm born here to do music. Like I'm put on this earth to play music. I can't imagine my life without music, and I'm grateful that I found that at a young age. But I encourage you all to find your thing. Maybe some of you already have that thing that you love to do. Maybe you're passionate about something that I didn't even say because I don't even know about yet. I want you all to keep investing in yourselves and investing in your passions, because you never know where it'll lead you. So I got my first grant as a native artist. I got the MTV thing, and I graduated from art school. And during that time, it was the MTV documentary dropped the fall after I graduated. We were filming it the summer after I graduated, and I knew that once that documentary dropped, like I'd be able to hopefully turn it into a career, and that happened. I started getting booked to perform. I started getting booked also to give keynote addresses. So music also helped me find my voice, and that music was how I started out on the stage, but slowly over time I also started getting asked to give presentations and keynotes, which is something I never thought I'd do. But I found that I was able to do that because I come from a community of storytellers, and I'm sure those of you who, all the natives on the line, you could probably think of 10 good storytellers in your family and in your community. So it's in us as native people too. So I was also able to take all these gifts that I have as a native person and kind of mold them into the native artist that I became, and I was able to kind of build a career that I wanted. And it's a lot of work, and it's not easy, but it's also a blessing, and I realized what a blessing that was, even at a young age, to be able to do that. So fast forward to a few years after I did the MTV documentary, I landed an artist residency at the University of Delaware. And I want to share this story because this is another way that music became a powerful tool for me to help people heal. So when I was at the University of Delaware, I was guest lecturing in music classes, but I also was working with music and art therapists at a children's hospital. So in Delaware, they have one of the largest children's hospitals in our country. It's called Nemours Children's Hospital. And the residency that brought me to the University of Delaware was a collaboration with that hospital, where the university would bring an artist that was using music, culture, to find healing in their practice. And they selected me in 2017, and I spent the spring semester out in Delaware, not just at the University university, but at the hospital, I worked with all of the children, all the young patients. So it was a children's hospital, everything from like heart transplants to, like brain tumors. For that whole semester, the whole spring, I worked with the music and art therapist, and we created a song together. So I basically like went into like producer engineer mode because that's what my degree was in. And like fast forward just a little bit of backtrack, up until that point, I had spent years doing music production workshops in different Native communities with young Native people like yourself, everything from like reservations to small towns to cities. So I had a lot of experience working with young people to, create a song together, to teach about music production. And it's funny, like I said, now I teach that at a university, but it started out, in community with people, with young Native people. Again, Walks with the Young Nation, that was my Lakota name. So at the hospital, we spent the whole semester working on a project, and I created a beat, and it exists on YouTube. It's called Love Helps Me Heal. Maybe I'll drop the link in the chat for anyone that wants to watch it. It's like a 4 or 5 minute song, but I worked with several patients and their families, and we created a song from the ground up. There's singing in it, there's rapping in it, but the theme for the song, so I think this is the message. For like the first couple weeks, all we did was just get to know each other, me and the patients. I would visit their rooms. Some of them were very sick. They when we talk about music being a tool for healing, some of them were going through some really hard ailments, some really heavy stuff, and sometimes they couldn't participate fully every time, so we just had to keep meeting with each other and getting to know each other. And through different workshops we came up with a title for our song, and the title for the song they selected is Love Helps Me Heal. And the reason why they selected that title is because they said, they were getting medicine, they're having surgery, these young kids, these patients, but they said love from their family, their parents, their siblings, love from the nurses and the doctors and the staff. The love is what was helping them heal. And so it became this really beautiful project where we wrote a song together, we recorded it together, and we actually created a music video because the music and art therapist who were already there followed me around with a camera and filmed and took photos while we worked on the project. And so we created a music video, and we had a big, we rolled out a red carpet, and we had a big event in the hospital atrium. We brought out all the patients, and we brought a big screen, and we showed the music video for the whole hospital. And I feel like that project really helped me understand the role that music can have helping people heal, not just like emotionally. Like I said, music helped me with my mental health. But I also seen how whenever you help with your mental health, it helps with your physical health too. And that's the truth, that a lot of those kids were going through a lot of physical ailments, but when we were working on music, when they were singing, when they were rapping, when they were watching the music, I would see them light up, and it would seem like they felt good, even if for a sliver of time, So music also has the powerful tool when we help it heal our emotions. Our bodies kind of follow that, because our emotions and our body, our heart and our mind, it's all connected, So whenever you work on your mental health, it also helps with your physical health. And so music is a powerful tool, not to just, help you get hyped up for a basketball game or something, but I really have actually seen people use music to help them get through things like, cancer, through things like heart transplants, through things like brain tumors during that time. And so I want you all to know that music is a powerful tool in that regard too. So if you end up using music to help you navigate hard times like that, just know that I think that's something that human beings are capable of as well. So I'm going to drop in the chat the link to that song that I made with the kids at the hospital. It's on YouTube, on the hospital's channel. It's something I'm still proud of because I learned a lot during that time. But before, I'm going to close out here, and I'm going to actually see if I could close out with a song on native flute. So my journey with music, like I said, started on instruments, and it also started on native instruments, piano, drum, and native flute. So I still write songs on this, and if you listen to anything that I've produced in the last 10, 12 years, there's native flutes in it as well. So as a music producer, I've also found ways to bring like native sounds and native culture. And I've even, if you've ever listened to my music, I produce a lot of native music or music about natives as well. And so I'm going to share a song that I wrote on flute to help me heal from a very traumatic medical thing that I went through. So, we were talking about mental health here, and I want to give you all you young people a note. And when I was your age, I kind of thought I was a little invincible. I was an athlete, my body was healthy. I was a res kid. I thought I was tough. I am tough and I was tough, but I thought my body didn't have a limit. But my body definitely did have a limit. And when I was 30 in 2020, I worked myself too hard on the road. I was just on the road a lot. I didn't take care of my rest, and I ended up actually having an epileptic seizure, and the ambulance had to be called. And actually, my mom suffers from epileptic seizures, and one of my uncles. So it's in my family. And I didn't think that it would get me, but it got me whenever I ended up like pushing my body and my mental health to a limit. And I had a seizure. I had to get taken to the hospital. I was hospitalized in ICU for a week, actually. And during that time, the hospital really mistreated me because of things they didn't know about Native people. For those of you who know like Lakota ceremony, Sundance, I have Sundance scars on my body from piercing. I've been doing that since I was 19. The hospital seen that. And even with like my family and my loved ones saying like, no, this is ceremony, this is Native stuff, they were trying to diagnose it as self-mutilation. And they're trying to say I was like a crazy person. And then another thing they did is I actually woke up while I was intubated with a tube down my throat, which is a terrible experience. So I had a lot of suffocation trauma from that. And whenever I came out of the hospital after being hospitalized for a week, I felt like my spirit left my body. And this is something that I know from Lakota culture and ceremony. We're taught that in times of trauma, your spirit can leave your body entirely. Like we believe that right now you are a body inhabited by our spirits. And I think there's also, Western medicine backs this up. I think there's some psychology stuff to back this up, that during times of trauma kind of gets frozen at its peak. And I think it has something to do with also like how you could get triggered. And if something triggers you, it's like you're back in that space. It's like, I think it's connected to how our spirits leave us sometimes during those times of trauma. And in our culture, we believe your spirit can leave like in pieces or entirely. And, I think I knew what it felt like in pieces, but whenever that happened to me at the hospital, it felt like entirely. When I got out, it felt like I was just like this empty body. Like it felt so, I still never felt like that in my whole life coming out of that. And I remember I felt like I needed to call my spirit back. And because I had a seizure, like my brain was just like glitched out, like for like almost a whole month. My brain was not working like it should have. Like I couldn't even remember my laptop password for like a couple weeks, So it also connected to my music. Like if I couldn't even remember my laptop password, I wasn't able to like produce and engineer and mix music and put out albums and songs like I had been in videos like I had been doing. It like kind of knocked me down, and it made me like come up with a whole different practice and a whole different way to connect to music, because I couldn't connect to music like I did in the past because my brain was glitched out at that time, and it was like it wasn't even working like it was supposed to. And so what I ended up doing is I really ended up connecting to the instruments that I played, including the flute. So whenever I got home, and again, I felt like my spirit had left my body, I knew I needed to call my spirit back. We have ceremonies for that in our culture, but I felt like I needed to play a song to call my spirit back, like a specific song for me to call my spirit back. And I kid you not, like I'm not lying to you all, that day, the song that I'm about to play for you all on native flute was just plopped down into my mind from, I believe, my ancestors, because to this day I've still never had this happen where like I heard a whole song in my head from front to end. Like that's never happened. Usually how I write songs, and other songwriters I know do it this way too, is your songs usually start with like ideas, like seeds, like a chord progression or a line, and then you kind of like add to it. And again, my brain was glitching out. Like I felt empty. I couldn't even remember my laptop password. It felt like my mind was just empty. And when I got home, it felt like this song was way in the back of my mind, and I needed to go to it and play it to call my spirit back. And so I know that this song is a gift too, and I share with you all, I said that I had been participating in ceremony since I was a young teenager, and so I'm a deeply spiritual person. I'm really connected to Lakota spirituality, and I believe that, ancestors and spirits guide us, and music has been a tool for me to connect to that, and I'm not a medicine man, I'm not claiming that, but there's been times where music has has allowed me to make a connection that saved my life spiritually. And this was one of those times. And whenever I got home, I picked up my flute. I'd been playing native flute for some years, and I stepped outside and I played this song to call my spirit back. And this became a song that I play all the time. This song became like a prayer to me, and I performed this song a lot on stage. This song also became a tool to call other spirits home. Not to get too heavy, but a few years back, a young cousin that I grew up with who's younger than me took his own life, and it was very sad, and his family asked me to speak at his funeral, and I spoke at his funeral, and I played this song to call his spirit home, so it became a song not just for me, but for other spirits as well, I feel like. And so I'm going to end on this song. Hopefully, Zoom don't glitch out on us, because sometimes lately when I try to play music, it freezes up. So if it freezes up or you stop hearing sound, please let me know ASAP, and we'll change up the plan. But this is the Calling Your Spirit Back song. All right. Thank you to the organizers for having me. I'm Frank Juan. I know I ran like a minute over, but thank you all for being there, or being here. Thank you for listening. To all you young people, please take a little seed of a message from anything I said, and know that you can have a good life and you can build the life that you want to have.
Thank you so much, Frank. You could have ran 20 minutes over, and I'm sure we would have been perfectly fine with that. That was amazing. You have a lot of praise and thanks in the chat. I don't know if you can see it. But I do want to make time, as I'm kind of gathering myself from that amazing presentation, to see if there's anybody that has questions or comments or wants to respond to you in the various stories that you told.
Yes, for sure.
Yeah, I would love anybody to either raise your hand.
Yeah, any questions? I'm a teacher. I love questions. So if any of you had any thoughts or questions, just let them flow. This is the space for that.
Awesome. I'm gonna go like this so I can see everybody.
And thank you for the words too, the kind words, because like I said, my Lakota name connects to you all, so it flows both ways. Let's see, there's a question. Worked with Deaf-Eye. Yeah, I know Deaf-Eye. Deaf-Eye is the brother, that's the homie. So, Indian country isn't that small. The presentation before, we kind of heard that, and native music scene is like even smaller. So you do it long enough and you kind of know all the natives sooner or later. Future collabs in the work, I seen that. So I actually just took some time off of teaching. I spent the last 2 years on a residency teaching at a university in Michigan, and that was kind of like full time. But I've written a lot of music, and I'm gonna work on that now and release it this next year. In collaborations, I actually collaborated with a class I taught with like 30 music students at that university, and we wrote and finished a song that I wrote about my great grandmother who survived boarding schools. And so I got some exciting collaborations coming out that I haven't had time to work on, but now I do. So be looking out for that. Oh, link to the documentary. Let me go grab that real quick. I have. Okay. All right, I'll drop a link right now. I just found it real quick for YouTube. It's called Rebel Music Native America. It came out in 2014.
And when I send out our post-event links and resources, I'll make sure I have those in there as well for folks.
Let's see, question. How did you handle leaving medical school and handle that internal choice as I support college students who are getting degrees they don't really want to? That's a great question. You know, I think that this is a great question, and this brings up a great point and a great story. Whenever I made that shift from like pre-med to imagine, you know, I was 19 at the time. I had a full ride scholarship, and people around me were like, he's gonna go from being a doctor to being a rapper. You know, I think a lot of people didn't understand it at the time, but it honestly was my mother and another elder that kind of confirmed it for me, that let me know I was making the right choice. And for my mom, I sat down and I had a long conversation with her about, look, this is what I want to do. I don't want to study pre-med anymore. I want to study music in some sort of way, and I'm going to figure that out. But I remember after I had that conversation with my mother, she and I'm grateful for this, she said, you know, if you got this far in your life and your education doing something you weren't that passionate about, I'm now seeing, I can only imagine how far you're going to go with something that you're interested and passionate about. And she's absolutely right, you know, because I feel like I'm still going. And another interaction was an elder from my reservation who knew me from the sports days and would always check in on me when he seen me. He saw me at a gas station the year I took off from school. And he's like, hey, what you doing at home? So I told him like my plan, I'm taking a year off, you know, I want to focus on music. And he kind of did that other thing. He just kind of shook his head and took a moment, and he was like, sometimes music is the best medicine. Whenever I told him I didn't want to be a doctor, like I want to do music, he's like, sometimes music's the best medicine. And that kind of, I was like, he's right. It kind of clicked for me, you know. So, you know, to answer your question, I would say, you know, have definitely, whenever a young person changes a life path, you should have a good conversation with them about the whys and the hows, like I did with my mom, so that she could see that I was really serious about this and I was really like I wanted to do this route and this path. And then the elder, just even though it was like a 2-minute conversation, like just confirming and being like, yeah, you're right, you know, you did that, and I could see you doing music too, and music is medicine. Just like those little confirmations are letting me know that, yeah, you know, that's a path that I think you could do, you know. Or maybe if it wasn't a path, I also had people that didn't believe I could do it, you know, which was hard, and I had to way more people thought I couldn't do it than thought I could, you know. So I think those voices that were supporting me and just hearing me out about what I wanted to do meant a lot, because I focused on that more than the negativity. That's a great question. Yeah, so for any young people listening to, just know you can change your path. You know, you're young, you still got time to figure it out. And for the educators supporting that, you know, it's a journey, as we know.
Frank, I'm wondering, I have a question. I think about some of the folks that I see on here and some of the folks I saw on our space yesterday, and a lot of them are in programming for their tribe or health care clinic, and they work with youth or they want to provide services to youth. And I'm just wondering if you have any advice or maybe an idea that you could share to kind of shift that youth programming into more of a arts-based, centered around behavioral health.
Yes.
Like if you could dream up a program, what would that look like?
That's a great question. And I think the specifics of what this would look like would kind of be different for each region. But for me, like when you say dream it up, I think that the intersection of like healthcare for Native people, art, and I think culture is that connection. Like find like what are your individual tribal cultures? Like what are the art practices? What are the music practices? Like I said, for me, like music is tied to ceremony so much, you know, because we sing songs. I love singing ceremony songs. So the alcohol treatment program on our res, and I've seen this at a lot of different treatment programs, will have a sweat lodge, and you know people can go and sing. And even though I haven't participate in those programs, I've gone to those sweats and I've prayed with those people, and I've had relatives that have gone to those programs, and I find that cultural programming really helps people, Native people, ground ourselves of all ages. And I find that for young people, this is true not just for Natives, but I've seen this in my students I was working with. I think they're really looking for like some spiritual connection, because they grew up, a lot of them too, during the pandemic, you know, online on a Zoom, and that was a different experience for those of us who grew up around our our peers in school settings, you know. And so I think that a lot of them are searching, even if they don't vocalize it or they're not aware of it, searching for connection. And I think that for our tribal programs, there's a lot of really cool avenues to explore and how we can bring culture and how art and music is weaved into our cultures, because like no matter what it is, it'll help with mental health, you know, whether it's sweat, whether it's working with horses, whether it's beading, like almost every element of Native culture helps with our mental health. Like I really can't think of too many things that wouldn't, you know. So finding ways to integrate our culture into the programming, and knowing that that's special for us as Native people, especially in tribal lands, because I've been around the world and I've seen like no one has what we have. Like we've been through a lot with genocide and colonization and what we deal with now, but our cultures and our connections to each other and our families like is one of a kind, and I don't see that anywhere else in the world, you know. So just leaning on that as much as you can and exploring that as much as you can.
Thank you. All right. Well, I think at this time, Frank, I just want to thank you for being here with us and just giving so much to us this afternoon. It was a beautiful way to close out our time. So thank you so much. I'm going to go ahead and share my screen for just a minute. I would like to just remind folks that there is a survey in the chat if anybody wants to fill that out. It helps us plan for future events, maybe even next year's Virtual Behavioral Health Youth Summit, who knows? And I want to just take a moment for the speakers that maybe are still in the space or will watch this recording later to extend the biggest thank you. I think when we were planning this space and this event out, we kept going back and forth of like, who should the audience be? It should just be youth. No, it should be, you know, program staff. And we felt it was really important to create a space where everybody could join, in the sense that there could be some level of accountability moving forward. So youth now have heard so much inspiration and so much motivation to, you know, use their voice and step into their medicine that they have and the power that they have, but also, you know, programming staff and elders and aunties and uncles that are in this space too, will now know that, you know, they can also reach out to these youth. And so I hope that, you know, as we close out today, that is something that came across in these presentations and in the space and in the comments. And so, yeah, just a final thank you. I'm going to stop recording and ask that Chris Tallbear joins us again to close us in prayer, and then we could go ahead and close for the day. So thank you. Let me just stop this recording.